Welcome to TopRank Review Academy's free online lecture series. This is Caroline Pelaez, and I will be your host for today's event. So today we are having our TopRank Nursing Lecture Series, which started on the 24th of May until the 30th of this year. And we are going to discuss the latest trends, updated nursing core concepts. And this has started yesterday with Sir EJ Flaminiano. Today we'll be having medical surgical nursing, endo, diabetes, mellitus management, foot care by Professor Lester Lintao. And tomorrow we will be having community health nursing, primary health care, and health education epidemiology by Professor Jessie Daclis. That would be from 2 p.m. until 4 p.m. And on the 27th, we will be having Professor Archie Alves from 6 to 8 p.m., who will be discussing maternal nursing, common obstetric complications, and normal delivery nursing management. On the 28th, we'll be having Professor Leonel de Guzman from 2 to 4 p.m., who will be discussing fundamentals of nursing and medical surgical nursing, angina, myocardial infarction, and IV therapy. And that would be 2 to 4 p.m. Next is pediatric nursing on the 29th of May, Professor Archie Alves from 6 to 8 p.m., who will be discussing common pediatric gastrointestinal diseases. And last but not the least is Professor Kenneth Arzadon, who will be discussing psychiatric nursing, schizophrenia, and therapeutic communication. So guys, this is part of our Bayanihan Review Assistance Program, wherein we are giving out a free review to our students. And considering that there had been a lot of cancellations already of the board exams this year, we are going to have as well a free pharmacy board exam review and this will be for a month. We will be having a crash course and final coaching on the 29th of May until the 25th of June 2021. So if you know anyone who's interested to join, please do inform them to sign up. We'll also have another free veterinary board exam review, crash course, and final coaching on the 28th of June until the 27th of July. And please inform your friends and family who would like to join this veterinary board exam review program. So for the benefit of everyone who doesn't know who TopRank Review Academy is, let me just run you through our company profile. So we have started in 2013. Right now, we're already considered as one of the biggest national review centers here in the country. We currently have 20 local branches and 4 international branches. So for our local branches, let's start with our main office in Manila. We are located right in front of PRC in Moraita. We are located at the 5th floor of the Don Lorenzo building. Aside from our Manila main branch, we also have branches in Quezon City, Marikina, and Caloocan. For provincial branches, we have branches in Lawag, Baguio, Dagupan, Nueva Vizcaya, Tuguegarao, Bataan, Bicol, in Legazpi, and Naga, Cebu, Iloilo, Tacloban, Calbayog, Davao, Bacolod, Zamboanga, up until Coronadal, South Cotabato. And what's good with our online interactive review is that we could reach the farthest places in the Philippines, even if we don't have a branch there yet. But prior to the pandemic, we have already opened branches internationally. So we have branches in Indonesia in partnership with the Ministry of Health, and we have opened branches there in Jakarta and in Bandung in Indonesia. So what we basically do is we provide them international exam review as well as trainings and seminars. And we were even invited at the 70th anniversary of diplomatic relations of Indonesia and the Philippines. We were very honored to have been invited in this event prior to the lockdown, because amongst all the other review centers here in the country, we are the only review center who was invited. We also have branches in Dubai and in Abu Dhabi in the United Arab Emirates. So what we provide there is SPLE review, as well as international exam review, such as NCLEX, HAAD, Prometrics, UKCBT, IELTS, and OET. And for our track record, guys, we don't only offer nursing, but we also offer dentistry. So if you know anyone who's looking for a review center for dentistry, please do inform us them to just send us a message through our Facebook fan page. Our top one came from Centro Escolar University. Here are our top notchers, and as well as licensure examination for teachers. Top two came from UP Manila. Psychometrician review and criminology. Our top one came from Universidad de Zamboanga. And we are very happy to announce that just last night, the results for the radiologic technologist licensure examination has already been announced. So we've got the top one, 3 top 3s, 1 top 6, and 1 top 10. So we're really very happy with these results, and we are very happy because we were able to help a lot of students not only pass, but also top the board exam. Our top one came from St. Louis University, and as well as our previous top one also came from SLU Baguio. We also have our products of our online review for MedTech. Here are our top notchers, as well as respiratory therapy. These 4 students are also products of online. We also offer midwifery and, of course, our nursing review program. So let's start with 2013, wherein we only had 2 top notchers. And after that, in 2014, we had 3. And then we had 6. And in 2015 was the first time that TopRank was really well known already, because we had 16 top notchers in just one season in the May 2015 nurse licensure examination. And of course, right after that, in November of 2015, we had 20 top notchers in just one season. 2016 is really good as well, and 2017, but in 2017 of November was the first time that we got our first top one, Sir Raymond Maniago, which is also one of our esteemed national lecturers. He came from UP Manila. In 2018, we also had our next top one from University of Pangasinan, Sir Mark Tristan Robosa. And in 2019, our next top one came from Angeles University Foundation, Miss Jeremiah Paula Austria Caceres. And of course, Miss Shaina K. Watanabe from Davao Doctors College. So there, we already made history, not only for nursing, but also across all professions. So in nursing, we had our top one from 2017, 2018, and 2019. And because of that, we are now hailed as the best national review center by multiple award-giving bodies, such as the Golden Globe, Best Choice, Q Asia, Global Awards, and Global Excellence Awards. So guys, we also have books on sale. If you're interested to purchase, just send us a message through our Facebook fan page. Our Top Rankers Guide, which is our review book, is now down to 1,099 from 1,350, as well as our Battle Strategies, which contains around 1,000 board-sensitive questions with Socratic reasoning, rationale, and test-taking strategies. So please do send us a message if you're interested to purchase our books. For our review proper, we are still open for the enrollment of our final coaching for the July board exam. It will start on June 8th. And for the November boards, our review will start on June 25 for our refresher phase. We still have an ongoing promo, which is a discount of 500 pesos if you enroll on or before June 1, as well as our weekend class, which will start on July 3. Our promo is just until the 1st of June. We'll have a 1,000 peso discount. So just send us a message if you're interested to enroll. Our Facebook fan page is Top Rank Review Academy. So without any further ado, let us all welcome our lecturer for today, Professor Lester Lintao, who will be discussing medical surgical nursing, endo, diabetes, mellitus management, and foot care. Hi, Sir Lester. Good afternoon.
Good afternoon, Ma'am Kay. Good afternoon, everyone. All right, as I was saying, good afternoon. Can you hear me? Can you guys hear me? Okay. So if you can hear me, please give me a feedback so I can start the lecture. Good afternoon to everyone, to those who are here in Zoom and to sa mga nasa Facebook Live. No? Okay, I can see you there. And thank you again, once again, thank you to TopRank actually for this endeavor. Nakakatawa kasi with these times of pandemic, we need help, no? In any way we can get actually, and then there are such activities. Okay, hindi mo lang masasabi lang na basta-basta ng activity or help, but it's actually a quality help given by such centers now. Okay, coming from a quality review center at that. So again, thank you, Ma'am Kate, and thank you, TopRank, for this opportunity. Also, let me extend my gratitude to Sir Roland Villegas, who actually heads this review center. No? Okay. Before I start my lecture, medyo excited ako. No? Okay. But before I start my lecture, actually, let me just congratulate. Okay. Napakita kanina, pero let me congratulate TopRank for, again, helping the students ace the board exam. No? Grabe, nagulat ako gabi. I'm about to sleep. Last night to rest, nakita ko, top notch na naman. I'm excited. Okay. Kasi sa nursing, I'm sure you will actually repeat this thing. No? Okay, that I believe and I suspect that I have in my prayer as well, that you have the same achievement. Okay, pag na-release yung result ng board exam. No? So with that, okay, let me start my lecture. Magandang hapon once more, and thank you for joining us this afternoon. So with that, okay, my chosen topic actually is endocrine system, but I isolate ko talaga DM. No? If you would see the vaccination, ito talaga rin ang mga no? Nalagyan ng mga so ngayon yung topic niya, vaccination and all, actually, those are my topics. Sinasabi ko lang that, pag nakita mo yung priorities sa Philippines sa vaccination, sa A3, yung mga co-morbidity, no? And one of those lists, topping the list, is actually DM. This is diabetes. That diabetes is there, it will mean that okay, it's a common morbid price, like a common morbidity rin, not only here, but the whole world, no? Okay. So with that, let me isolate, and by the way, okay, ilang araw na bago mag-board exam. Okay? You want to take an exam sa July, July 3 and 4, let me remind you, you exactly have 38 days, 17 hours, and 35 minutes before your exam. Okay? Alam ko nakaka-nervous yan. Pero again, as you stay with us, as you reward us, okay, it's my prayer that you not only pass, but top the exam. And the question is this, if you've been with us for a while, let me ask you a question. What's your goal? It's our goal to top the exam. What's your goal? Okay, hindi ko marinig, no? Teka lang, hindi ko marinig yung aking effects, no? Okay, isa pang tanong, what's your goal? Ayun, nadinig din siya, no? Nasa my lecture na, nasa my topic about endocrine system, I usually start off by discussing about brief review of the anatomy and physiology, more on the physiology, kasi very important for you to know the abnormal, you should be able to know the normal. One more time, for you to know the abnormal, you should know what is the normal. So let me give the discussion now, okay, about the normal part of this discussion, yung discussion of the islets of Langerhans. By the way, some viewpoints that I researched this morning, okay, about this DN, okay, about the worldwide. Actually, ito siya, no? Okay, and I will show you the number of people it rose from 108 million in 1980, tapos ng 2014, biglang naging 42 million, no? Okay, the last year was 2020 actually. Okay, March last year, in that 704 million na ang VM worldwide. That accounts to almost 9% of the entire population worldwide. Now, diabetes is, ayan, nakalagay, major cause yan. Major cause ng blindness, kidney failure, heart attack, stroke, and lower limb ampulation. Okay, the distortion. Grounded yung mic. Sorry for that na. Alright, okay. As I was saying that, okay na siya? Hindi pa? Hindi pa rin? Putol-putol lang signal, putol lang ba? Okay. Okay na siya, sorry. I mean, napindot yata akong mali sa system ko. Malabo. Okay, that's weird. Hindi pa okay? Garal-gal pa rin? Hindi, pause talaga yung boses ko. Mahina tas putol-putol. Okay na, sige. Tama, may napindot akong, sorry for that. May napindot akong maling button, no? Alright, sorry for that. No, ulitin ko lang. Okay. As I was saying, that diabetes rose from, okay, thank you for that feedback, guys, no? Okay, medyo may napindot akong maling button sa dami ng pinipindot ko dito. Hindi ko alam kung anong unahin kong pindutin. As I was saying, okay, the number of people with diabetes rose from 108 million to 1980, 42 million, 42 million in 2014, no? Okay, last year, after nabalitaan ko that, okay, may introduction naman yun, no? Yun lang pa rin. Ganun pa rin siya. Sige, teka lang, wait lang, guys. I don't know what's the problem, but hello, check, test 1, 2, 3, 4, 5, 6, 7, 8. Checking 1, 2, 3. No, hindi siya nag-echo actually. Yeah, introduction pa lang. Oh, that's weird. Underwater. Hanggang ngayon? It's kind of weird. Okay na. Pag lumalapit sa kamo, maayos. Kapag ganyan, malayo. Ano ba ito? Pag binis na tayo nagaan. Bumalik. Oo. Okay naman, sige. Sige, give me a feedback again, no? Masyado atang malakas yung microphone, no? Okay. Pag malapit, okay. Sige, dapat ganyan ako. Nakatakot man. Sige, subukan ko lumayo, ah. Okay, pag lumayo, mag-e-echo siya. Tuloy-tuloy, sige. Bagalan ka ng konti, ah. Okay? Bagalan ka ng konti. Sige, as I was saying that, okay, the number, kaya pinili ko yung DM kasi sa part ng A3 ng vaccination natin, diabetes mellitus actually is one of those top, no? Isa yun sa top na nakalagay, okay, sa mga lista ng comorbidity. Right? Okay? So therefore, pag may DM ka, kahit na gaano ka kabata, talaga ipaprioritize. Of course, meron tayong protocol na above 18 dapat, no? Above 18 yung vaccinate. Nang that yan. Okay? As I was saying, here, I got this data from WHO. If I may repeat that, 1918, 108 million lang. Then 2014, 422 million. And last year, umabot ng 9% of the entire population. Again, 9% of the entire population. Okay, that's frustrating. 9% of the entire population. I don't know what's wrong actually, no? When it's close, sige. Okay, as I was saying, sige, subukan ko ulit. First time it happened to me actually, no? Hello, check, test 1, 2, 3. Lapit ka, sige. Let me just shift the microphone, ha? I-shift ko lang yung microphone ko. Palitan ko lang, ha? Para mas maayos tayo. Ilipat ko lang yung microphone dito. Check, test 1, 2, 3, 4, 5, 6. Is it better? Mas okay siya? Sige, subukan ko ulit. Just give me a feedback again, ha? Hindi ako masasatisfy, no? Ayan, better na yan. Sige, okay. I changed my microphone. Sorry for that. Hindi, pinaltan ko yung microphone ko. So sorry for that. Alam ko na, naka-on pareho. Sobrang gusto ko na, ayaw ko ng technical problem, lalo na technical problem. Balikan na tayo. Hindi ako makalaya. First page pa yun. Again, this is a major cause of blindness, kidney failure, heart attack, stroke, lower limb amputation. Those are real problems for this diabetes, no? Kaya nga talagang nakatap siya sa listahan ng mga sakit sa comorbidity. Worldwide yan, hindi lang sa Philippines sa checklist, kahit saan ka magpunta, magpapakuna, isa, yung diabetes talaga sa nakalagay na dahilan na uunahin kang bakunahan, no? So with that, okay, more important data is that between 2000 until 2016, there was a 5% increase in premature mortality from diabetes, and more so, okay, ang madaming namamatay yan is more renal failure talaga, or kidney failure, no? The one discussed yesterday. Okay. In 2019, an estimated 1.5 million deaths were directly caused by diabetes. Another 2.2 million deaths were attributable to high blood glucose in 2012. Alright, okay. So yun yung mga data last of 2019. So far, ng 2020, ang nabigay lang yung total number of cases, no? No new cases, or shall I say, no new reports about mortality or morbidity because of the lockdown, no? Lahat nakatutok sa COVID-19. Pero mind you, certain percentage of those who are dying because of COVID-19 are the ones suffering diabetes mellitus, no? Okay. With that, then let's talk about the physiology involved here, involved in DM. Okay. So let's talk about the alias of Langerhans, okay, which is actually a part of the pancreas, no? Now the pancreas has two functions. May digestive ka. Okay. At meron kang endocrine. Focus tayo sa endocrine function ng pancreas, no? Okay. At that, now, of course, pag sinabing pancreas yan sa DM yan, okay, ang pinag-uusapan islets of Langerhans. Now, the term islets pertain to million cell clusters throughout the pancreas. At least 3 cells, may 3 cells ang islets of Langerhans. So, nauna, the alpha cells which secretes glucagon. To review that, actually, okay, it accounts 20% of the islet cells. No? It accounts 20% of the islet cells. And that, ang purpose ng alpha is to produce glucagon. Once again, the purpose is to produce glucagon, okay? And actually, glucagon increases the blood glucose level. So this time, BS is blood sugar level or blood glucose level. Napalo yung alpha. Okay? Beta secretes insulin this time, which accounts 70% of the islet cells, no? So that ko lang, okay? That accounts 70% yan ng islet cells, and that it secretes the important insulin. Now, ang purpose naman niya is to lower the blood sugar level. Now, the best way for me to explain glucagon is by first explaining insulin, no? Kasi yung pangatlo naman, no? Okay, yung pangatlo na hormone natin, yung na cell, which are the delta cells, okay, actually secretes somatostatin. Now, ano yung somatostatin? Kalaban siya, yung tinatawag na somatotropin. May impact naman yon saan yon? Sa growth and development, no? Okay, though not my focal point of topic now, sa pediatrics madalas na encounter yung tinatawag na somatostatin. The somatostatin, again, okay, is a very important regulatory hormone, more on really sa hypothalamus, sa growth hormone functioning, actually. So, yan lang, okay. So, again, so for me to explain this one, let's zero in, focus on insulin at saka glucagon. If you will notice there, counteracting or counter-regulatory hormones silang dalawa, di ba? If you will notice here, okay, that, tingnan mo dito, tingnan mo yung glucagon increase blood sugar level, where insulin lowers the blood sugar level, no? So, nagka-counteract silang dalawa. Okay, at that, no? Alright. Sige lang, let me just, I don't know what's happening, no? Naka-okay na siya eh. Alright, sige, okay. Let me figure out, ganda. So this is frustrating actually. This is the first time it happened to me, no? Anyway, okay. Sige, as I was saying that, okay. So, balikan natin ha. Sige, siguro lapit ako, no? Ganyan, no? Ganyan na lang. Kahit na malaki yung mukha ko, no? Okay naman daw. Sige. So anyway, so as I was saying that, let's talk about how it functions. So, of course, involve yung cell, involve yung glucose. And primarily, pag sinabing glucose, carbohydrates yan, no? Shall I say, pag sinabing the most important carbohydrates, glucose yan. That actually produces energy level yan, no? Okay. Sige, ganito yan, ha? Pag kumain ka ng food na may glucose, let me repeat. Pag kumain ka ng food na may glucose, within 2 hours, okay, 2 hours, glucose will go to the cells. And that, therefore, okay, therefore, what will transfer glucose to the cells? The answer is insulin. So, insulin transports glucose to the cells, okay? Again, span of 2 hours, kaya ang break time madalas, guys, kahit review yan, kahit work, and so on and so forth, madalas yan usually every 2 hours, no? Every 2 hours ka kakain, actually. Ganun siya, kasi nga, yung time presumption, na na-consume na ng katawan mo yung glucose na kinain mo kanina. Iba nga lang talaga, kain lang ng kain, no? Dire-diretso lang. Ulit, kumain ka ng food na may glucose, how many hours? 2 hours, pasok sa loob ng cell, magdadala, insulin, no? Insulin will transfer glucose to the cell. Now, on the other hand, okay, sir, paano sir, what if we take a lot of glucose, no? Wouldn't this suffer hyperglycemia? The answer is no. Kasi, pag sobrang glucose na kinain natin, may isa pang rule ng insulin. It involves in what we call as what? Okay, tinatawag siyang glycogenesis. Again, the insulin now involves in glycogenesis to actually form or convert glucose to become glycogen. Okay, so glycogen yan ngayon, sulat ko lang, glycogen will be formed like that. Now, saan pupunta yan? Actually, saan pupunta? Unang-una, sa may muscles, okay? However, most of them goes to our liver, being pertained to as the liver glycogen, which is highly important as a defense mechanism. Again, okay, from the start, and then let me zero in kung ano yung function ng insulin, no? Once again, okay, nag-take ka ng food na may glucose. The primary source of the last, carbohydrates, no? And that, pag nag-take ka ng food na may glucose, it will go to the cells within 2 hours, no? Okay, within 2 hours actually, within 2 hours, and that what will transport glucose to the cell is actually insulin. Now, pag sobrang glucose, convert siya to become glycogen, what will convert still is insulin, no? Insulin niya. So therefore, kaya ang role niya kanina is to lower the blood sugar level into how much? 80 to 120 milligrams per DL. Yan ang normal sugar level natin. And that therefore, okay, so sir, where will the glycogen go now? Saan pupunta yung glycogen? Well, okay, saan? Muscles sa liver. So anong purpose nun? What's the purpose of that to our body? When we suffer hypoglycemia, ito yan, okay, na-experience mo na ba ito yung tipong hindi ka nakakain ng time, nalipasan ka ng gutom, no? Noon, hindi ka, pinagpapawisan ka na, tapos biglang okay ka na, no? experience mo na ba yan, nalipasan ka ng gutom, no? Bakit nagkaganon? Bakit tayo nalilipasan? Bakit nagiging okay yung body natin kahit di tayo makakain agad-agad? Ganito yan. Okay? When you suffer hypoglycemia, presumably after 2 hours, no, of regular eating, so bumaba siya ng 80, halimbawa, nag-suffer ka ng hypogly, what will the body do? It will activate the alpha cells to release what? Glucagon. If you will recall that, no? Ano gagawin yan? Glycogenolysis naman, no? Gagawin niya is this. Okay? To actually reconvert glycogen going back to glucose, okay, as a compensation during hypoglycemia. Kaya na-mention natin kanina that ang glucagon will increase the blood sugar level. How again? By converting glycogen to become glucose during hypoglycemia in a method known as, or perhaps known as what? Glycogenolysis. Okay, yun siya. So from the start, okay, let's repeat before I continue. Kasi very important to understand kung bakit may hyperglycemia ang tao may diabetes mellitus. Again, kumain ka ng food na may sugar. Within 2 hours, pasok ang glucose sa loob ng cell. Pag sobrang sugar, maybe what will transport glucose to the cell is actually insulin. Okay, na pag sobrang glucose, example, take ka ng energy drink, no? Guys, ang energy drink is meant to give you energy kasi it's rich in glucose, no? Okay, kaya lang, meron siyang taurine kasi nakakagising, no? Now, let me educate you that. Ang taurine kasi, para siyang synthetic na caffeine. One more time, okay? Yung taurine is actually like a synthetic caffeine, okay? That it will actually, it's a stimulant, no? Magigising ka. Kaya may nakikita ko sa review lagi that when they're having a review, nagtitake ng sting, nagtitake ng sting o kaya ng cobra, ganyan, no? Which I warn them, no? Why? Okay? Kasi it's meant to be an energy drink, not to be a review drink, no? Kasi nga, nakaupo ka dyan maghapon, take ka ng sting, okay? Ang daming sugar. Let me give you an idea, 1 bottle of sting, yung strawberry flavor, na hindi ko sinisiraan yung product. Importante yan pag kailangan mo na energy. Kaya nga siya energy drink. Punta ka ng marathon, bisikleta ka ng 40 kilometers, ganyan. Okay? You need those, no? As source of your glucose. However, okay, yung 1 bottle ng sting contains 9 packs of sugar, no? And 1 pack is equivalent to 1 tablespoon. So parang kung kumuha isang bote ng tubig, nigyan mo ng 9 na kutsara ng asukal, yun ang content ng energy drink, no? You want to maybe by a stick later, then boil that. You form a syrup, no? Yung mga nagluluto dyan, alam niyo to, may syrup lang isang produkto o isang niluluto kapag marami siyang sugar, no? So be careful with such products, no? Kaya tamis talaga nila. Now, okay. So na-prove na natin kung anong purpose ng insulin to lower blood sugar level. How? By transporting glucose to the cell and converting excess to become glycogen. Okay? Now, ang purpose naman ng glucagon to increase the blood sugar level. How? By reconverting glycogen to become glucose during hypoglycemia in a process known as glycogenolysis. Okay? Don't forget those. Basta kahit makalimutan mo yung mga proseso, ang alalahanin mo yung dalawang hormones, insulin, at saka glucagon. Now, with that, kaya yung physiology na kailangan to actually amplify the topic of DM, no? Okay, so with that then, let's talk about DM itself. Like I mentioned earlier, I think na-mention ko na kung dito worth mentioning, no? The diabetes mellitus or DM is the most common metabolic disorder, no? Once again, okay, the diabetes mellitus is the most common metabolic disorder. Okay, and that, by the way, the exact cause, unfortunately, yan, madalas mo marinig, ha? Pag MS, psych, yung mga sakit-sakit yan, pag di alam ang talagang cure, hindi rin alam yung exact cause, na the exact cause is unknown. Okay? Kaya pag tinanong ka sa mga exam, okay, ano exact cause yan? Unknown. Pag di mo alam, unknown. Na matutunan mo sa review, unknown. Wag ganun, no? Okay. So anyway, so unknown yung exact cause niya, although may kanya-kanyang risk factors at saka predisposing factors bawat type ng DM. Okay. Now, let me give you the idea, no? Kung saan ko kinang lecture, kaya you might not see this really in books right now, okay? Because what I'll give you now is the update actually of the classification given by ADA. Now, ang ADA, American Diabetic Association, which is the authority in giving updates about DM, no? Kung baga sa CPR, ang authority mo ay that's American Heart Association, no? Sa hypertension naman, no? International Society of Hypertension. Kung ganun, dito naman ADA tayo, ha? Now, they give us 2 classifications and 2 types each. Of course, ang focus natin is sa dalawang type na under primary types. With that then, let's talk about the classifications of DM. Starting off with the type 1, or the acquired types, I mean, no? Okay. Diyan pumapasok yung common na alam natin. Yung tinatawag na type 1 at saka type 2 i-compare natin. Yan, we have type 1 here, formerly known as insulin-dependent DM. Okay. And type 2 is what? NIDDM, that's non-insulin dependent diabetes mellitus, no? That's IDDM and IDDM. Now, okay. Dati, I said dati, ha? Dati tinatawag to, no? Tinatawag yung type 1 dati na juvenile or child onset. Kaya ito naman dati, adult onset. Pero alam mo to, that in the recent years, ang dami ng bata na may type 2, no? Susunod, hindi na effective din sabihin mo na adult related, no? Kasi mga 12, 11 years old pa lang, meron ng DM talaga. Yung type 2 DM, no? So ano yung mga new names na binigay nila ngayon actually? So let's discuss that, no? Ano yung mga bagong names that are given to DM. So by the way, unang-una, tinatawag siya, ito is heredity related diabetes mellitus. Kasi number 1 na talaga genetics or hereditary. Alright, okay. Ito naman pangalawa, tinatawag siyang dietary-related DM or tinatawag din siyang lifestyle-related diabetes mellitus. Okay, primarily because it's based on diet, no? So marami kang sugar kasi malakas kang kumain, ganun lang yan, no? Okay, so have HRDM, saka DRDM. What's HRDM? Heredity-related DM. Pag DRDM is the dietary-related DM. Now, in here actually, anong problema ng type 1 is zero ang insulin. Sulat ko lang ha, okay? Zero ang insulin dito, to whereas dito, actually mataas yung blood sugar level. Kaya I'm telling you that's dietary related. Maraming sugar kasi malakas kang kumain talaga. Okay, pangatlo here is that here the client appears to be thin madalas, no? Kaya ito madalas obese. Okay, nag-exceed yan ng 25% of the ideal body weight, no? Obese patient. One more for that. Okay, for type 1 actually is that, okay, type 1 tinatawag siyang unstable type. You know why? Konting stress, tumataas yung blood sugar level, no? Ito naman stable siya. Okay, stable yung type 2, no? Kasi tataas lang yan if you eat a lot. Alright, okay. And that, by the way, the common complication for type 1 is diabetic ketoacidosis that we will actually somehow focus in a while or discuss in a while. And then, pag type 2 naman actually is what? HHNZ. That is hyperglycemic, hyperosmolar, non-ketotic coma, or some books call it non-ketotic syndrome, no? Okay, pwedeng HHNZ, pwedeng HHNS. So those are the types of it. So dalawang class na under-acquired types, ha? Okay, by the way, just to let you know that ang problema ng DM, hyperglycemia, right? Ayan, pag type 1, bakit nagka-hyperglycemia? Kasi nga, zero or walang insulin, no? Kaya pag type 2, ba't nagka-hyperglycemia? Malakas kumain, kaya tumaas yung sugar level, no? Especially nowadays, kay sama mo ng lifestyle talaga, no? Ito na nga lang review, Pati ako naapektuhan ng blood sugar. Bakit nga? Kaya pag nagturo ka, nakaupo ka lang, hirap naman tumayo. Online, no? Okay, tapos mamaya, pag nagutom ka, inom ka lang ng coffee dyan, kain ka lang, so on. Kaya puro ganun yung lifestyle natin ngayon, no? Okay, so again, therefore, kaya dumadami yung case of type 2 nowadays. Yung acquired, ha? Type 1, type 2. Type 1 heredity, type 2 by diet or dietary by nature. Now, we have another type is called the secondary types, ha? So, unang type, actually, are primary. Pag sinabi secondary, parang lumalabas secondary hormonal problems, no? So, unahin natin, let's begin with the gestational. Although, alam mo naman ito talaga, no? Okay, pag sinabing gestational, buntis yan. Sige, okay. Nakalagay sa book natin, actually, book-based tayo syempre, okay, that on the last trimester, shall I say, last month of the first trimester, on the transition of the corpus luteum to the placenta, hanggang nagka-function yung placenta, again, hanggang nagka-function yung placenta actually, okay, is that, dito may hormone na tumataas, right? Na kung tawagin HPL, what is that? Human placental lactogen, or that HCS, what is that? Human chorionic somatomamotropin. So mas simple, yung HPL, sulat ko yan, ha? Okay, so again, starting 3rd month of pregnancy according to books. Pero again, pinakamarami yan on the last trimester, of course. Pag fully functional yung placenta, on the 3rd month of pregnancy, okay, tumataas yung hormone na HPL. And let me write it for you, human placental lactogen. So what? Pag mataas yung lactogen, what happens there, okay, is this, that HPL is an antagonist of insulin. Let me repeat, okay, that HPL is an antagonist of insulin. So what? Pag mataas ng HPL, babagsak yung level ng insulin. Kasi antagonist nga siya, right? So what will happen then? Pag bumagsak yan, taas yung level ng blood sugar, magkaka-hyperglycemia, no? Kaya may ibang buntes may hyperglycemia because of that. Sir, paano mawawala yan? Kailan mawawala? Pag na-deliver na yung placenta, unti-unti magsasubside yung HPL, that means may-regulate yung hormones. Kaya huwag kang magtaka kung bakit yung ibang buntis, kahit type 2, are given with, sometimes with insulin just to regulate their sugar level, no? Ulitin ko, ha? Okay, on the 3rd month of pregnancy, tumataas ang level ng HPL, that is human placental lactogen, which decreases insulin, which increases blood sugar. Kaya may hyperglycemia. I told you the main problem of DM is hyperglycemia. Now, in the meantime, we have crashings related naman. Ang mataas naman dito actually is what? Glucocorticoids, no? Again, this is an endo discussion. So let me write that for you. Glucocorticoids. And the major glucocorticoids coming from the adrenal cortex is what? Cortisol, no? So ano ngayon? Okay. Let me just bring you back to one discussion actually. Okay. Now remember, yung ating mga nutrients, we have 3 macronutrients, right? Carbohydrates. Pag break mo yan, the most important carb is actually what I told you earlier is glucose, no? So one more time, sulat ko lang, okay? 3 nutrients and carbohydrates. Pag break mo yan, the most important glucose as a source of energy. Now, yung fats mo, nagiging ano siya, fatty acids. Yun dapat yung broken components ng ating macronutrients, no? Remember, ang carbohydrates may 4 calories yan. Ang fats 9 calories. And yung ka-level ng carbs 4 is yung protein, no? Na pag break mo actually, nagiging ano siya, amino acids, which is also a source of the amine derivatives, no? So maraming function yung amino acids na yan. Pero ito yung basic discussion for that metabolism. Therefore, pag tinanong ka, ano yung primary source ng glucose talaga? Carbohydrates. Through what purpose? Ano ang purpose process? I mean, through what process tinatawag siyang glucogenesis? One more time. Okay? Tinatawag siyang glucogenesis, yun yung carbohydrates natin, no? Na ito yung problema, ha? Okay? Maraming glucocorticoids. Ano bang role ng glucocorticoids? Tinatawag siyang gluconeogenesis. Sulat ko lang, okay? The purpose of that is that it enhances gluconeogenesis, no? Ito yun. Therefore, maraming glucocorticoids, bibilis yung gluconeogenesis. I-dissect natin yung word, no? So, simple lang. Pag sinabing gluco, sugar yan. Ulit. Pag sinabing gluco, sugar. Pag sinabing neo, new. Bago yan. Okay? Pag sinabing genesis, formation. So, what is that? Ang sabi ng iba, formation of new glucose. Hindi ganon. But rather, it's the formation of glucose from new sources. Yun yung point, yun yung ibig sabihin ng gluconeogenesis. Ulitin ko lang, there's actually formation of glucose from new sources, no? Therefore, kibalikan ko yung kanina. Okay? So again, and again, okay, ang source ng glucose is carbohydrates, no? Pag dumami yung glucocorticoids, what will happen? I-convert ng katawan ng glucocorticoids, yung fats sa protein to become glucose. Eh di ang nangyari dyan, pag maraming glucocorticoids, yung carbs mo, glucose. Yung fats mo, glucose. Yung protein mo, glucose. Lahat sila puro glucose. Kaya may hyperglycemia kapag may Cushing's disorder, no? Okay. Again, with that, because of that, again, yung fats and protein is being converted to what again? To become blood sugar or glucose water. Kaya may hyperglycemia kapag may Cushing's. Now, although I told you, okay, ang focus ko nasaan sa type 1 at type 2 under the primary types yung management, no? Kasi may kanya-kanyang management, kanya-kanyang discussion ang gestational at saka kasi sa kanya-kanyang topic, no? Okay, and that. Now, those are the types of it. So, may classification 1, A rather is primary. We have type 1 and type 2. And classification B are secondary types, which are gestational and Cushing's related. Okay, so with that, let's go and discuss yung pathophysiology, no? Pathophysiology of DM. Okay, kasi gusto ko mag-focus at gusto ko matapos hanggang discussion ng foot care, no? These are common concepts actually, not only for local board, kung magplano mo mag-take ng mga international exams, kasama to, no? Favorite tong DM na to actually. Not now, okay? With that, let's talk about pathophysiology. Anong problema nga? Hindi makapasok ang glucose sa loob ng cell, right? Or, kulang yung pagpasok niya. So, glucose stays in the blood, okay? That can lead to hyperglycemia. Again, glucose stays in the blood, that can lead to hyperglycemia. So, with that, pag may hyperglycemia, can yield you now the 3 P's of DM. However, I'll not enumerate it. We'll discuss them one by one kung ano yung mga 3 P's natin. Okay? Although enumerate ko lang, alam mo yan, polyuria, polyphagia, tsaka polydipsia. Kaso itong tanong sa exam dati. Okay? Anong mauuna? Is it polydipsia or polyuria? Ulitin ko, okay? Although we may engage in lesser interaction this time, kasi meron tayong Facebook, nahuhuli sila, no? Pero again, ang tanong ko lang is that, tanong sa exam, anong mauuna? Polyuria o polydipsia? Okay, i-discuss natin yan. And saan common yung polyphagia? Is it type 1 or type 2? Those are questions that you can actually, we can answer after I discuss the pathophysiology of diabetes mellitus. Balikan ko yung diagram ko kanina, no? In fact, okay, let me make a new one actually. So ito halimbawa, ha? Okay, ito yung blood vessel natin halimbawa. That's the blood vessel there. Okay, and that, we have here the cell. Cell yan, ha? Ay, mali. Pumasok yun. Ito yung cell, I mean, sorry. Sorry, nakakaranta ko. Ba't okay nakaban yung araw, no? Ito yung cell, okay? Blooper, kasi I've been preparing since 12 o'clock actually. pati yung microphone, tapos ganito. Kaya I'm upset pag ganyan, no? Pag ganyan may problema ang technology, no? So, okay lang. Okay. So, as I was saying that, ito tayo ha, game. Okay. Nag-take tayo ng food na may glucose, no? Glucose. I told you earlier, within 2 hours, pasok ang glucose sa loob ng cell. Now, anong problema sa DM? Kulang or walang insulin. Okay. So, pag tinanong ka, anong hallmark ng DM? Anong symptom ang hindi pwede mawala sa DM? Ang sagot doon, hyperglycemia. Once again, okay, the hallmark of DM is hyperglycemia. Yun talaga siya. And that, okay, with the hyperglycemia will yield a lot of symptoms and even complications. Sige, ito na ngayon yan ha. Okay, ato yung glucose, kulang or walang insulin. What happened? Nagka-hyperglycemia. With that then, with that notation actually that, okay, ang mangyayari is that tataas yung blood sugar, tataas yung viscosity ng blood. Nilapot yung blood, thus increasing the osmolarity. Okay, now I was watching yesterday, sa lecture ng renal actually, okay, na-mention somehow itong mga to, no? Kasi pag renal, hindi pwede maiwasan ang discussion ng mga fluid concepts, lalo may fluid concept yesterday, no? Okay, so ito tayo ngayon ha. So again, okay, tumaas ang glucose level, what happened is that lumapot yung blood, tumaas yung viscosity, tuloy, tumaas ang osmolarity. Thus, therefore, can create now osmotic changes or fluid shifting. Okay, so ito mangyayari dyan ha. So let's define osmosis by the way. Osmosis for the first time today. What is osmosis again? The movement of water yan, or solvent, no? That's a proper term. The movement of solvent or water from an area of lower concentration to an area of higher concentration. If I may repeat that, okay, osmosis is the movement of water from an area of lower concentration to an area of higher concentration. No? Now, I have two spaces being mentioned there. Ito yung intracellular, ito yung intravascular space. No? So, A is the intracellular, B is the intravascular space. So, with that sense, okay, to which area has the higher concentration? Yung B. Kasi andito yung glucose, no? Okay, hindi nga nakapasok sa loob ng cell kasi kulang or walang insulin. So again, okay, andito yung glucose sa blood. So tumaas yung concentration sa may B sa intravascular space. Therefore, following the definition of osmosis, movement of water from an area of lower concentration to an area of high concentration, actually, anong movement is A to B? Okay, A now will add the water, now will be drawn out. Okay, saan? Papunta ng blood, causing now fluid volume excess. Again, okay, it will cause increase in fluid volume excess, no? Okay, at that, so in which case, sige, balikan ko to, ha? So again, nawala yung water. Okay, hinatak from A to B, yung water napunta dyan, nag-expand yung blood volume na yun, no? Okay, it may cause possible fluid volume excess. Dyan na magsisimula yung pathophysiology. Na ito na, okay. So therefore, nawalan ng water ang cell, right? Pag nawalan ng water yung cell, magkakaroon ng tinatawag na intracellular dehydration. Once again, okay, pag yung water nahatak palabas, it can cause intracellular dehydration. That's ICD, no? Okay, at that. So, nasan yung water? Nasa blood. I told you mag-expand yung blood volume, right? Ito na ngayon yun. It will expand, causing fluid volume excess. So, what will happen next? Okay, pag nagka-fluid volume excess, actually, of course, it will increase the functioning of the system, right? Na unang magko-compensate yung heart. Kaya expect natin actually that, okay, yung mga taong may hyperglycemia or may DM at that, talagang tumataas yung heart rate, no? They suffer tachycardia actually. At sinasabi nga ng libro natin, 100% of the uncontrolled DM patients suffer prolonged tachycardia, which is detrimental to the heart. Diyan pa lang, pwedeng tumaas yung blood pressure. Now, okay, according to Brunner, that bawat pump ng heart, 22% ng blood diretso ng kidneys, no? Again, bawat pump ng heart, 22% ng blood diretso ng kidneys. So ngayon, lalakas ngayon yung pressure sa may kidneys, no? So sulat ko lang, okay, because of that increasing heart rate, tataas yung filtration ng kidneys, tataas yung pressure towards the kidneys such that, okay, pag umihi yung pasyente, anong lalabas? Lalabas yung glucose to the urine. Natandaan natin to, ha? Pinapatakas talaga ng glomerulus yung glucose, pero konti lang, may sinatawag na threshold, no? Konti lang yung lalabas na glucose talaga. Now, pag may DM, dahil maraming blood, maraming glucose, what happens there? Okay, pag tumama yung glucose sa may glomerulus pack, ano mangyayari? Tatakas yung glucose with that urine, no? Kaya nagkakaroon din ng glucosuria. Again, increased pressure there will cause possible glucosuria. So literal, na may langgam or may talagang nilalanggam yung urine, no? Langgam na Tagalog, hindi Bisaya, no? Langgam. Okay, actually, may langgam talaga yung kanilang urine. Kaya pag nag-CR yan, hindi naka-flush. Expect for ants to go there kasi literally, may glucose yung urine. Ito na ngayon, no? Okay, so balikan natin, ha? Yung pasyente, umihi ng glucose na may urine, kung tawagin glucosuria. And remember this, glucose can exert its own osmotic pressure. Again, glucose can exert its own osmotic pressure. Therefore, paglabas ng urine, may glucose. Hahatak pa mas maraming water, right? Yun, doon nagkakaroon ng polyuria. Okay? Kaya polyuria is caused by what? Tinatawag na osmotic diuresis, no? Okay, so palagi akong summary sa next page, then balikan ko to, ha? Okay, balikan ko yan. So again, number one of the P's actually is polyuria. And once again, the cause of polyuria, osmotic diuresis. Na pag tinanong ka naman, anong cause ng osmotic diuresis? Ang sagot doon, glucosuria. Okay, so sa first P there, na polyuria is caused by osmotic diuresis, no? So ayan, okay, from the start. Sige, sa start tayo sa osmosis, no? Nag-shift out ng water from the cell to the blood, causing intracellular dehydration. So yung water nag-stay dito, okay, increasing the blood volume, right? Now prompting the heart to compensate, increasing the heart rate, of course, no? Okay, pag tumaas yung heart rate, natural, tataas yung pressure towards the kidneys. Pag expel ng water, may kasamang glucose. Kami tinatawag na glucosuria. Ang glucose kayang humatak ng water, right? It can exert its own osmotic pressure. Once again, that glucose can exert its own osmotic pressure causing what? Polyuria. So, nasa yung water? Eh di nasa CR na, di ba? Pwede rin sa gulo ng kotse, basta umihi ng buhi. Okay, natanggal yung water. Thus, therefore, the plant will suffer what? Extracellular dehydration, ECD, no? That's extracellular dehydration. So, ngayon, okay, may intra ka na, may extra ka pa. Dalawa yung dehydration mo, right? Okay, anong tawag dyan, guys? Total dehydration. Natanong dito, okay? Pag na-dehydrate yung katawan natin, what's the first defense of the body against dehydration? Thirst. Kaya magkakaroon ng tinatawag na persistent thirst. Ang tawag sa kanya, polydipsia. Okay? And the cause of polydipsia, therefore, number 2 here, the cause of polydipsia, sulat ko lang, okay? It's actually what is total dehydration. So those are the first 2 P's. Kumbaga, sige, tanong sa exam ngayon, okay? And I believe you can answer by yourself, no? Kahit walang interaction ngayon sa may Zoom tsaka sa Facebook. Shout out sa mga nasa Zoom. Thank you so much for joining, no? Okay? And thank you again for TopRank for this endeavor. Alright, kaya as I was saying, balikan ko, ha? Okay? So ang sinasabi ko dito is that the first 2 P's natin, ha? Anong cause ng polyuria? Osmotic diuresis. Ang cause ng polyuria is total dehydration. So nung mauna, polydipsia, polyuria. Ang tamang statement sa exam, polyuria precedes polydipsia. One more time. Okay? That polyuria precedes polydipsia. Mauna yung polyuria bago magka-polydipsia. So first 2 P's down, polyuria and polydipsia. The third P is commonly happening to type 1. No? It rarely happens to type 2. And let me prove that to you. I told you earlier, ha? Okay. Anong problema ng type 1? Zero insulin, right? As in kahit konti, wala talaga siyang insulin. Again, problema ng type 1 as in zero ang kanyang insulin. Kahit konti, wala siyang insulin, no? So ito ngayon, ha? Okay. So balikan natin therefore yung third here. I'll write that after the explanation, no? So let's create another diagram here. Example, ito yung blood vessel. Ito yung cell. Ayan siya, ha? Okay. So again, nandito yung glucose. Na question, pag sinabing type 1, may insulin ba? Wala talaga. Kahit konti, nada, nil, zero, no? Zero glucose to the cell. Therefore, kung walang glucose ang cell, the client will suffer what? Cellular starvation. Okay, starvation, or some books call it deprivation, no? Okay, again, walang glucose ang cell, hindi makapasok sa loob, no? Kasi zero or walang insulin. Pag type 2 kasi kahit konti, merong insulin, right? Okay, since walang glucose ang cell, magkakaroon natin ng cellular starvation. Again, some books call it cellular deprivation, no? Nagutom yung cell, causing a patient to be weak, no? Magkakaroon talaga ng weakness yan. Remember, I told you that pag nakapasok yung glucose sa loob ng cell, it will produce energy. This time, wala siyang energy, magkakaroon siya ng weakness talaga. In fact, some books call it profound weakness. Dalawang sakit ko lang nakikita yung profound weakness yan. Unang-una sa Addison's, pangalawa sa type 1 ng DN, no? Okay? As in profound, sobrang kahinaan siguro na, no? Okay, at that. So again, ulit, walang glucose ang cell kasi zero insulin, right? Since walang glucose ang cell, nagka-cellular starvation. And again, nag-starve yung cells, nagkaroon ng weakness yung client. Yung naging weak siya, the body will what? Activate a primary compensatory mechanism, no? Okay. Kaya lang, false compensation siya, no? Magkakaroon siya ng tinatawag na false compensation. When I say that, ganito, no? Okay. Pag nagkaroon ng weakness, yung pasyente actually, yung akala ng katawan ng pasyente, kulang siya ng glucose. What we did do, it will cause primary activation of the compensation, no? And matanong ko lang, okay, what's the primary compensation against starvation? Hunger. Again, the primary compensation against starvation is actually hunger. Kaya magkakaroon ng persistent or excessive hunger that we call polyphagia. Doon nagkaka-polyphagia. Now, let me complete my list a while ago. So, 3 P's tayo, ha? First, polyuria. Anong cause? Osmotic diuresis. Second, polydipsia. Anong cause? Total dehydration. And third, polyphagia. Polyphagia is third here. Okay? Ang cause naman yan is cellular starvation. So, nakompleto siya. Kaya lang ituloy ko na yung discussion nung type 1, no? Kaya let's extricate the complication for type 1 DM, ha? So, again, ulit isa pa, dali. Okay? Again, ang cause ng polyuria, osmotic diuresis, polydipsia, total dehydration, polyphagia, cellular starvation. Now, let me review that in this diagram from the start. Okay? Walang glucose ang cell, right? Kasi zero insulin. Pag walang glucose ang cell, magkakaroon ng cellular starvation. Pag nag-starve ang cells, gutom yung patient. Pag nagutom siya, okay, nag-activate yung defenses against cellular starvation, no? And that una dyan, kala ng katawan ng pasyente kulang ng glucose, no? Kasi hindi pumasok sa cell. What's the first compensation? Hunger. Kaya magkaka-persistent hunger that we call polyphagia. Anong solution, sir? Okay, pakainin ba siya ng kalahating kilo na asukal? Wag. Painin mo ng syrup? Wag. Remember, ang problema niya, insulin, hindi glucose, di ba? Therefore, ang solution dapat ang bigyan mo ng insulin. At anong type nagbibigay ng insulin? Type 1. Kaya I told you that yung polyphagia is rarely happening to type 2, no? Malas type 1 yan kasi walang glucose in loob ng cell. Now, may binigyan na suggestion si Portman, no? Author ng libro yan, okay? Sabi ni Portman, dapat daw, pag nagkaroon na ng ganyan, okay? Nagkaroon na ng polyphagia, bigyan siya ng insulin, no? Dapat yan bigyan ng subcutaneous na insulin. Subcu insulin that must be given with a time frame na binigay niya within 30 minutes up to 3 hours. Again, time frame niya within 30 minutes up to 3 hours, yung binibigay dapat na frame for it, no? Okay. So with that, paano pag di nabigyan? Well, pag di siya nabigyan ng insulin, kahit pakainin mo pa siya, ito mangyari sa kanya. Mag-activate yung secondary defense against cellular starvation. Unfortunately, is the release of what? Glucocorticoids. Nakadidiscuss ko lang kanina. Again, lalabas yung glucocorticoids, no? Review ng konti. Anong purpose ng glucocorticoids na ulit? Gluconeogenesis. Again, andito yun kanina, balikan ko lang, ha? Okay. Ang purpose niyan actually ng glucocorticoids, gluconeogenesis. Anong gagawin nga niya? I-convert yung fats and protein to become glucose. Again, the purpose of that is gluconeogenesis. Ang gagawin niya, convert fats and protein to become glucose. So discuss natin yan, ha? Okay. Now, in this scenario, therefore, again, nag-force activate yung glucocorticoids. It will do gluconeogenesis. Sulat ko rin lang, ha? May force yung gluconeogenesis, formation of glucose from new sources, right? Ito na ngayon yan. Okay. Yung protein mo, imbis na maging amino acids, magiging ano siya? Glucose. Again, yung protein, imbis na maging amino acids, magiging ano siya? Magiging glucose. Makakatulong ba yan? Hindi. It will aggravate the hyperglycemia. Pangalawa, yung fats mo. Okay. Yung fats mo, imbis maging fatty acids, anong magiging siya? Magiging glucose. Makakatulong ba? Hindi pa rin. It will aggravate the hyperglycemia, right? Ang problema ito, pag nag-convert ka ng fats to become glucose, again, pag kinonvert mo yung fats to become glucose, anong waste product niya, guys? Ketones. Again, at the moment mag-convert ka ng fats to become glucose, ang waste product niya actually are ketones, no? So, dadaming ketone bodies sa blood. Ito ngayon yan. Okay. Ketones have very, very, very low pH. Therefore, pag mababa ang pH, anong problema? Acidosis, alkalosis? Ang sagot doon is acidosis. Thus, therefore, the client will suffer what? Metabolic acidosis. Now, yan yung tinatawag ngayon na diabetic ketoacidosis, no? That's DKA. It's called diabetic ketoacidosis. Okay? I told you earlier, the primary complication for DM1 or type 1 DM is DKA. Ano DKA? Diabetic ketoacidosis, no? And mind you, ha, DKA is an emergency. It is a crisis. Now, okay? Before I leave this one, just medyo ang discussion talaga pag ganito, ang hirap ng feedback kasi nga, di ko alam kung may nagsusulat. Okay, the confidence that you're watching and then you will be taking, you're taking notes kung anong ginagawa niya, no? Siguro you can review the video naman later. I don't know kung nakasave to na actually. Okay, but anyway, so balikan natin to, ha? Again, okay, ang pasyente may type 1 DM. Now, zero insulin. Okay, walang glucose ang loob ng cell, right? Nung walang glucose, nagka-cellular starvation. Nag-starve yung cells, naging weak yung client. Okay, natuloy kala ng katawan, kulang siya ng glucose. Pero the fact is that hindi lang nakapasok sa loob ng cell, right? Okay, ito mag-activate yung primary defense against cellular starvation, which is hunger. Kaya may persistent hunger that we call polyphagia. Solution, saksakan na insulin. Suggestion ng libro, within 30 minutes up to 3 hours. Pag di nabigyan ng pasyente, the body will activate the secondary defense, which is the release of glucocorticoids. Okay, anong gagawin niya? Gluconeogenesis nga. Okay, it will force gluconeogenesis. Okay, we should convert protein to become glucose. Makakatulong, I told you, hindi. Kasi it will aggravate the hyperglycemia, right? Okay, isa pa, yung fats naging glucose, makakatulong, hindi pa din. It will actually aggravate the hyperglycemia, and thus, anong waste product niya? Ketones, for causing now diabetic ketoacidosis, no? Okay, nagkakaroon ng diabetic ketoacidosis. So, DKA. Now, tapos tayo sa 3Ps actually, no? We're done discussing the 3Ps of diabetes mellitus. With that, okay, we have to discuss now yung DKA, no? Kasi minsan, actually, ito yung nami-miss out na topic actually, no? This is very important kasi crisis siya, part siya ng emergency, part siya ng MSN doon, daming pwedeng pag-discussan ito. Unfortunately, minsan nakakalimutan namin, no? Okay, kumbaga hindi nasasalo yung topic. So with that, then, let's have this opportunity to discuss DKA. Now, pag sinabing DKA, okay, is called diabetic ketoacidosis, no? Anong cause ng cellular starvation? Now, ano yung mga symptoms sa DKA are the following. Unang-una, may abdominal pain. This is global to all acidosis actually. So, let ko lang ha, first of the symptoms, kaya tawag siyang abdominal pain. Once again, global yan to all acidosis. Pangalawa, nagkaka-weak and thready pulse. Again, a global manifestation of acidosis, no? That's weak and thready pulse. Weak and thready pulse yan. Okay. Number 3 there, na manifestation niya actually, ito na yung classics natin, no? Okay. It will aggravate the 3Ps. Okay. Yung 3Ps lalalayan, polyuria, polydipsia, polyphagia. That's to some degree, makakatulong yung polyuria. Again, I am saying that to some degree, makakatulong yung polyuria, no? Okay. And let me explain why in a while. Okay. And number 4 here, by the way, number 4, as a manifestation, ito na classic, no? Nagsalita yung pasyente. Anong amoy na hininga niya? Amoy acetone. We call that what? Either fruity odor breath or the acetone breath. Sulat ko lang, okay? It's called the fruity odor breath, fruity breath. Thank you sa nasumasagot. Thank you for the Orella for interacting sa Facebook, no? Okay, this fruity breath, fruity breath or the acetone breath. May sumasagot, no? Ayan, okay. Ayan ang maririnig, maamoy mo, no? Maririnig ko lang. Maamoy mo sa patient, the fruity breath or the acetone breath. Classic yan. Number 5 dito actually, okay? Ito, 5 and 6 are the dangerous ones, no? Remember this one, okay? Ketones actually, ketones can cause sedation of the brain, no? That eventually can cause possible altered level of consciousness. Pwede makoma, ha? Pag nakoma, ang tawag dyan, ketotic coma. Pwede yan, ha? Pag na-alter yung level of consciousness, pwede makoma. Kung tawagin again, ketotic coma. Now, ano yung number 5? Number 5 is a way of compensation talaga. Kasi paliwanag ko, which is actually very classic for DKA, no? So, ganito. Okay. Ang mataas na acid ngayon is ketones. That lowers the pH of the blood. Kaya may ketoacidosis. Matanong ko lang. Sige, sulat ko muna, ha? Okay. Ang abnormal na acid this time, sulat ko lang, okay? Yung abnormal na acid this time is ketones. Bakit nga? Break down mo yung glucose. Yung fats to become glucose, right? Okay. Ayan, ketones yan. And that, okay, ang abnormal na acid, ay, nasulat ko. Ang abnormal na acid in is actually ketones, no? Ketones yan. Okay. Ngayon, ano yung primary acid natin? Well, the primary acid is this, ha? Carbonic acid. The primary acid, sulat ko lang, carbonic acid. Now, if you would recall this one, ang carbonic acid natin actually is dissolution of 2 components, water at carbon dioxide, no? So ganito ha, okay. Yung water natin dissolves the carbon dioxide. Mag-chemistry tayo ng konti. Again, water dissolves carbon dioxide, CO2 yan, okay? And that ang purpose niyan is to form H2CO3. H2CO3, ladies and gentlemen, is the carbonic acid. So component yan, kaya di ba yung discussion ng ABG ninyo, okay, pag maraming carbon dioxide yung katawan, pwede talaga magkaroon ng respiratory acidosis, right? Kasi the primary acid is carbonic acid and that's dissolution of water with carbon dioxide. Now, ang problema is that maraming ketones. Sir, kaya bang tanggalin ng katawan yung ketones? Yes, kaya niyang tanggalin. No? Ang problema, it will take you to flush. Again, it will take you to flush around 600. Check that. Actually, 300 to 600 cc of urine. Bago matanggal yan, no? Okay, that i-flush out mo 300 to 600 cc of urine bago ma-flush out yung ketones. Kaya I told you earlier, somehow, nakakatulong yung polyuria, right? Kaso ito okay. Kung ang urine output mo is 30 up to 60 cc per hour lang, it will take you around approximately 10 to 20 hours bago matanggal yung ketones. By then, baka na-sedate na yung brain, baka comatose na yung patient, no? So, gagawin ng katawan, mag-compensate siya ngayon, no? Okay, sige, ulitin ko, ha? Ang basis dito, yung balancing ng acid, no? Ang mataas na acid, ketones. Abnormal yan, no? Okay, in which case, ano yung primary acid na normal sa katawan talaga? that controls the acid-base balance? Carbonic acid, dissolution of water and carbon dioxide. Now, with that then, okay, so ang problema dyan, kayang tanggalin yung ketones, kaya it will take time to remove it, no? Approximately by normal circumstance, okay, mga 10 to 20 hours, I told you by then, it can sedate the brain, can cause already what? Ketotic coma. So yung katawan gagawa ng paraan, no? By decreasing the carbonic acid. Ay, ang gagawin ng katawan, okay, is decrease the carbonic acid. Anong way ng katawan to decrease carbonic acid? To expel more carbon dioxide. The way of the body to remove to lessen the carbonic acid, to expel more carbon dioxide. How? Through fast and deep breathing. Kung tawagin Osmosis breathing. Okay? Therefore, pag tinanong kita, sige, sulat ko lang, okay? Ang sa pang-symptom dyan na classic actually is Osmosis breathing. No, classic siya. Ano nga ang Osmosis breathing? Deep and rapid breathing. Ganyan pahinga yan, no? So what? Bakit kailangan ng Osmosis breathing? Very good, Omar, no? Okay. Bakit kailangan ng Osmosis breathing to expel off carbon dioxide as a compensation for the atoll acidity of given by ketones, no? Yun nga lang problema, no? Okay. Yung Osmosis breathing, ang intention, good or bad? Good, kasi compensation siya. Yun nga lang, okay? Pag tumagal ang Osmosis breathing, may chance na expel off lahat ng carbon dioxide. Should that happen, okay, it may lead to what? Respiratory depression, no? Remember, pag naubos na walang ka na CO2 as a stimulant for medulla oblongata, pwede mag-deal yan o mag-lead rather saan? Okay, respiratory depression. Kaya somehow nakakatulong siya pero kailangan i-address at once yung problem. Bakit? Pag tumagal yung Osmosis, can expel off all the carbon dioxide, can lead to another fatal problem, breathing problem na, respiratory problem naman, no? That is respiratory depression. Okay? Therefore, kailangan i-manage to. Kailangan i-manage yung DKA, no? Tanong sa exam. Okay? What is the only management for DKA? The answer is IV insulin. One more time, okay? The only management for DKA is IV insulin. Sulat ko lang. Okay? Management, by the way, guys, ang topic pa lang, management pa lang ng DKA, ha? Babalikan ko yung management ng DM, mamaya siningit ko lang yung DKA as a virtue of additional learning, no? So again, the management, only management, IV insulin. Now, what's the only insulin given IV? Madalas sinasabi, regular insulin. I checked several references kung bakit regular, kasi daw, unang-una, has the least allergic reaction. Pangalawa is a clear insulin, no? Okay, yan siya, yun nga lang, ibigay mo via IV. Now, when giving insulin via IV, monitor for the following. Unang-una, malamang hypoglycemia. So, watch out for complications, sulat ko lang. Okay, possible complications of use pag gumamit ng regular insulin. Complications number 1, okay, is hypoglycemia. So, watch out for manifestations of hypoglycemia. That will be discussed in a while, no? Doon ko na yan banatan sa may management mo, sa drugs mismo, no? Okay, that's hypoglycemia. Pangalawa, hypokalemia. Kasi pag biglang pumasok ang glucose sa loob ng cell, kasi in-IV mo nga siya, isasama niya yung potassium, no? So watch out for signs of hypokalemia. Madalas ECG monitoring, right? And what do you see? Pag may hypokalemia, is actually the prominent U waves, no? You see that, okay? And third here, na complication, edema. So once again, okay, when giving insulin via IV, watch out for hypoglycemia or hypokalemia at saka tinatawag na edema, of course, no? Okay, yun yung mga manifestations for DKA and the management for DKA, no? And the only management I told you is IV insulin. Okay, so yun yung discussion yan. So let's go back to our mainstream of our topic. Balikan natin si DM, okay, yung diabetes mellitus, no? Okay, and that, no? Niche case, okay? Ito yung, so tapos tayo sa 3Ps, ha? Review ng konti. Ano yung 3Ps nga? Polyuria. The cause is osmotidiuresis. Polydipsia. The cause is what? Total dehydration. And polyphagia. The cause is cellular starvation. Okay, so let's go discuss now. Therefore, yung ibang complications, no? Let's delve in and discuss the different complications of DM. Yung isa sinabi ko na, for type 1 is DKA. Now, i-cluster natin na, i-divide ko yung dalawa sa complications, okay? Acute complications and chronic complications. Siyempre, mas common yung chronic, no? Kasi pag uncontrolled yung DM, dun lang lumalabas talaga yung chronic complications. Let's discuss it now. Okay? So, tapos tayo sa 3Ps. Let's discuss now the chronic, the complications and complications for DM. Let me start with the acute ones, no? Yung acute muna tayo, acute complications. Okay? At pag acute, actually, pwedeng problema sa, teka lang, A is acute. Okay? Yung type 1. Pag type 1, sinabi ko na, ang komplikasyon, DKA. Sulat ko, ha? Okay? Pag type 1 DKA, okay, ang cause niyan cellular starvation. Pwede magka-comma actually. Okay? And that pag nagka-comma yan, ang tawag sa kanya ketotic comma. Ketotic comma is complication for type 1. Pag type 2 naman, HHNC. Na actually, halos na-explain na, no? Okay, by virtue of pathophysiology. So again, so pag type 2 tayo, ha? Again, komplikasyon ng type 1, DKA. Caused by cellular starvation. Ketotic comma, yes, known as ketotic comma. Ngayon, pag type 2 tayo, HHNS or HHNC in other books, no? Okay, to compare the term, actually, let's use the words, the acrostics HHNC. Okay, ano yung NC stands for non-ketotic comma. Sulat ko lang, HHNZ, okay, and the NC stands for the non-ketotic comma. And again, some books call it non-ketotic syndrome. Okay, pwedeng comma, pwedeng syndrome. Kaya pwedeng HHNS, pwedeng HHNC, yung term na binibigay sa kanya, no? Okay, na halos na-discuss na yan. Actually, so, review lang natin, no? Pag type 2, may insulin, yes, pero mataas yung blood sugar level, no? Kulang ng insulin pag type 2. Now, this is the blood vessel here. Ito yung cell, no? Okay, andito yung glucose. Kasi kulang ng insulin, mas marami pa rin glucose sa may blood, no? So, that therefore, may hyperglycemia, right? Kaya may, ano siya, hyperglycemic. Okay, this hyperglycemic by nature, no? Now, pangalawa, pag hyperglycemic, ano yung viscosity nga? Mataas. Mataas yung viscosity ng blood, no? Okay, now, pag viscous yung blood, anong problema? Tataas yung osmolarity, remember? Therefore, kung mataas osmolarity, ibig sabihin, meron siyang hyperosmolar state. And so, sulat ko sa pangalawang H, that's hyperosmolar. So, hyperglycemic, hyperosmolar siya, no? One more time, hyperglycemic and hyperosmolar. Ayun na. Okay. So, bakit na coma? Ito nangyari dyan, ha? Okay. This HHNC may happen pag sobrang taas ng sugar, no? Ang ibang libro nakalagay 600. Iba naman 800, iba 1,000. So, arrange natin. Okay. Arrange natin yung books natin. Actually, that pag ang blood sugar level, inabot ng 600 to 1,000, no? Okay? Ganyang kataas yung sinasabi ng books natin actually, that's milligrams per DL. Sobrang taas from the normal, which is 80 to 120. Now, again, okay? Pagka ganyang kataas yung blood sugar level natin, 600 to 1,000, okay? Anong mangyayari nga? Magkakaroon ng shifting, right? From A to B. Tanong, madidehydrate ba yung cells? The answer is yes. Madidehydrate yung cells, di ba? Kaya lang ito, pag sobrang taas ng sugar daw, ganyang kataas, lahat ng cells madidehydrate. Ulitin ko, okay? Pag ganyang kataas yung blood sugar level, lahat ng cells madidehydrate. And I mean, lahat. The books would say lahat, no? Including the brain. Therefore, madidehydrate yung cells ng brain. Magkakaroon na cerebral dehydration. Natanong lang, okay? Sulat ko, because of that shifting, magkaka-cerebral dehydration, no? Natanong, pag na-dehydrate ang brain, pwede makoma? Yes, pwede siya makoma nang walang ketones. Kaya ang tawag sa kanya, non-ketotic coma. That's hyperglycemic, hyperosmolar, non-ketotic coma. So, anong question therefore, is cerebral dehydration o pwedeng sagot cellular dehydration talaga. Okay, isa pa, game. Okay, pag type 2, meron ba siyang may insulin ba? Yes, kaya lang, gamayra. Konti lang, no? Basit lang. Okay, konting-konti ang kanyang insulin. Na pag konting insulin, mas mataas yung sugar sa blood, kaya may hyperglycemia. Ayun, no? Kaya hyperglycemic, no? Na kung hyperglycemic siya, ang shifting ng blood is from cell to cell to blood, no? Shifting ng water is from cell to blood. Okay? And that therefore, ang shifting A to B. Na pag mataas masyadong sugar, range siyang 600 to 1,000, what happens? Lahat ng cells madidehydrate, including the brain cells that can cause what? Coma, na wala namang ketones, kaya ang pangalan niya hyperglycemic, hyperosmolar, non-ketotic coma. Okay? Yung HHNC, sabi ng mga doktor actually, even the books nakalagay, ang management daw niyan, okay, is hypotonic solution, no? Kailangan i-dilute ulit, no? I-dilute yung blood para bumalik yung water to the cells, no? That's actually hypotonic solution are being used. However, this time, okay, is already guided by a physician or a doctor. Okay? Yung mga complications ng DM under acute pa lang, no? Pag chronic na, okay, pareho na sila syempre. Discuss natin therefore, ha? Okay, letter B tayo. Letter B, I hope you're okay, guys. Okay, letter B tayo. Masyadong formal yung lecture pag ganitong magkasabay. Okay, so letter B tayo actually is yung mga chronic complications na sabay na, ha? Sabay na yung type 1 tsaka type 2. Sige, magagawa tayo ng basic pathophysiology and the term used by the board exam, no? Now, problema nga, may hyperglycemia. Alright, kaya problema may hyperglycemia, no? Pag may hyperglycemia ang patient, anong viscosity nga? High viscosity. Thus, therefore, kapag viscous yung blood, what happens? Nagkaroon ng sluggish blood flow. Sluggish means mabagal gumalaw yung blood, no? Sluggish blood flow, mabagal siya. Ito yung words na ginamit sa exam dati. Sluggish talaga or slow, no? Sluggish blood flow. Okay? Kaya after the exam dati, may lumapit sa akin, sir, ano sluggish? Na. Okay? Hindi alam yung terms. So medyo siguro mahirapan na sagutin kung hindi mo alam yung terms na ginagamit, no? With that. Okay? So pag sluggish and blood flow can lead to what? To problems on both the macro and the micro circulation, no? Thus, therefore, lagay natin dito, may circulation problems, no? Circulation problems may happen. Unahin natin, no? Now, unahin natin actually, tama, Omar, okay? Because sa taas ng pressure ng heart, tsaka viscosity ng blood, okay? Number one dyan talaga is hypertension. Yan, no? Pwede magka-hypertension yan, okay? At sinasabi ng books na, parang kanina lang, no? Okay? Na 100% ng taong may DM talaga, na, shall I say, let me validate that, okay? 100% ng taong may type 1 DM, I mean, mali ulit, okay? 100% ng uncontrolled DM suffer hypertension, no? Kaya din naman siguro isa sa nakalista talaga sa comorbidity ng vaccines natin, no? Na A3 actually, kasi nga, syempre may hypertension doon, more so is DM, alright? Okay, number 2 is actually formation of atherosclerosis. Bakit ganon? Kasi masyadong malapot yung blood, eh. That's atherosclerosis, teka lang, that's atherosclerosis actually, okay, masyadong malapot yung blood at may chance ang makadeposit yung fats sa may lumens ng blood vessel, no? So, condition known as atherosclerosis nga. Question, okay? Pag may atherosclerosis, delikado ba? Yes, of course, no? Okay, pwede magkaroon ng ng unang-una, pwede siya magka-stroke, CVA. Kaya isa yan naabangan talaga. Okay? Na iniiwasan, I mean, kapag may DM. Na pangalawa, pwede magkaroon ng coronary artery diseases like angina pectoris or even myocardial infarction, right? And even the different types of peripheral vascular disorders, no? Okay? Mga distant at that, especially yung sa paa, okay, pwede magkaroon ng congestion doon, no? Okay? Ang mga atherosclerotic diseases, CVA, coronary artery disease, saka peripheral vascular disorders. Number 3. Okay? Number 3 actually affecting major organs, nephropathy. Okay? Na dati pag tinuro ko pa actually, okay, sinasabi ko macro circulation siya, no? Okay? However, someone asked me, and of course, let's form correction, kaya sometimes I love corrections, no? Okay? It's about a way to learn better, no? Pero sa totoo lang, okay, ang nakalagay talaga dati sa books, macro complication siya, no? Macro circulation, no? Okay? Sabi ni student, sir, micro po. Nabasa ko sa ganyan. Okay? Nung binasa ko, nga naman, no? However, pareho kami tama kasi both macro at micro sa kidneys and thus, therefore, nephropathy can lead to possible what? Kidney failure, no? Na-mention natin kanina, kidney failure may happen to a patient, no? Okay? Kaya guys, never stop learning, no? One of the ways to learn is to learn from others, no? Kahit mga estudyante, I learn from you guys, no? So, minsan okay yung may mga magtatanong. Ang ayaw ko lang matanong, alam mo yung yung mga challenging questions, no? Yung mga, alam na yung sagot, tatanungin ka, tapos nag-search sa internet, no? Doon ako naiinis sa totoo, no? Okay, maganda sabihin mo na lang, kung may correction, let's do it, let's correct it together, no? Pero, to a point that, pero okay lang magtanong, ha? Pag ganun. Pero this time, I don't think we can fit the time for that. But if you have, sure, why not, no? Okay, sige, first, hypertension. Pangalawa, atherosclerosis. Pangatlo, nephropathy. Pang-apat, ha? Okay, fourth complication actually is that, okay, during sexual intercourse, in the absence of balance, let's discuss this a bit, no? Okay, during sexual intercourse, what makes the penis erect? The answer is blood supply, no? Again, during sexual intercourse, okay, what makes the penis erect is blood supply. For the men, ha? For the man, ha? At gaano karaming blood supply? Medyo madami kasi sabi ng libro, 6 to 7 times, no? 6 to 7 times ng blood supply ng penis, no? Ganong kataas yan during sexual intercourse. Problema nga, yung lalaki may DM, malapot yung blood. Anong tendency? Hindi makaabot on time yung blood niya sa penis during intercourse, no? And that therefore, what happens is that okay, nagkakaroon siya ng diabetic impotence, ayaw tumayo ng penis, no? Awi? Okay. Anyway, okay. I mean, anong dito, ang DI, ibang sakit yan, ha? Problema siya sa ADH actually. It was discussed yesterday sa fluids, no? Kasi problema ng ADH yan, kulang or walang ADH naman kapag DI. Pwedeng transient, pwedeng permanent insufficiency ng ADH yan, ha? Kaya ang counterpart din actually SIADH naman, which I watched yesterday, yung online lecture kahapon, pinanood ko yun, na-discuss yung DI at saka yung SIADH na in relevance to the kidney functioning. So again, okay, so balikan ko, ha, I was saying there that may cause possible diabetic impotence, na? Okay, number 5 tayo, number 5. Okay, ayun, presensya na sa awit ko, ha? Awit? So mga kabataan katulad kasi namin, lingwahe namin. Okay. Balikan ko, ang seryoso ng mood, ayoko itong ganito, no? Gusto ko medyo kalug-kalug na lecture, no? Okay. Anyway, sige, okay lang, total lang. Ang mahirap niya, nauna sa akin si EJ, no? Sir EJ, Sir Winner, no? Yun talagang he can crack the jokes at any given time, mawa kasi trying hard eh. Impotence may happen to a client na isa pa. Nagkasugat yung pinakamalayo sa heart, no? Nagkasugat yung pinakamalayo sa heart. For example, okay, anong pinakamalayong structure galing from the heart? Natural, paa. Unless giraffe ka, no? Okay, giraffe ka na mas mali mas malayo sa yung ulo mo sa heart mo, no? Okay. However, nagkasugat yung paa, ang hirap gumaling kasi ang layo from the heart. Yun, may mga tumatawa na sa Facebook, may mga tumatawa na sa Zoom. Yan ang gusto ko, no? Okay, hindi masyadong seryoso. Okay. Again, nagkasugat yung pinakamalayo from the heart. Ayun, natural. Okay, unless na giraffe ka. Okay. Ngayon, pag nagkasugat, ang hirap umikot ng blood, right? Kasi malapot eh. Okay. Na minsan, naabutan ng gangrene. Tama yun, Omar. Good answer here. Okay. Now, gangrene, mga infection of that. Okay. Ang tawag sa kanya, diabetic foot ulcers, no? Part ng discussion yan kasi it's totally preventable. And mind you, pag di na-control yan, can lead to possible septicemia, which is hard to control, no? Okay. Anyway, okay. Kasi may nasabing maging seryoso. Kasi magseryoso kayo sa pag-aaral, hindi ganito. Okay. Talagang ko actually, so foot ulcers may actually be problems, no? So in a while, I'll be giving you some picture, showing you a picture, no? Sana kaya ninyo kaya kumain na kayo ngayon, wag lang mamaya before I show those pictures of necrotic tissues of those foot ulcers. Pag naging necrotic yan, saan tutuloy yan? Septicemia. It's hard to control, no? Septicemia. Now, with that, okay. In the meantime, number 6 dito. Sige, halos mga ito talagang purely micro. Nabanggit ni Justin dito sa Facebook. Totoo to, no? Tama to, no? Okay. At that, okay. May tanong dito, if babae may diabetes po, wala masyado yan, no? Okay. So, mention ko, lalaki talaga, no? Lalaki yung circulation. Kasi ang babae naman is lubrication, more really hormonal changes, no? At that, okay. So, I don't think may problema yan actually, no? Okay. It's more naman having a problem sa may impotence during DM. Alright, okay. So, I hope I answered that. Okay. Anyway, so number 6 dito actually, ito na mga sa blood circulation ng eyes. Okay, and that may cause possible what? Na-mention ni Justin sa Facebook, tama, retinopathy may happen. No? And the first manifestation is actually blurring of vision. Remember, it can cause blindness. Kaya na-mention sa onset ng lecture natin kanina, DM is one of the leading causes of blindness. But let me tell you what, that the most common cause of blindness nowadays, hulaan niyo kung ano, the improper use of contact lenses. No? Ulitin ko, okay? The most common, sabi ng WHO ng year 2012, that's April of 2012, dineclare siya, the most common cause of blindness now is no longer glaucoma, not even this one, but rather the improper use of contact lenses. So, ingat-ingat sa mga naka-contact lens dyan, no? Okay? Lalo na kung ang contact lens, so pang-change lang ng color, wag na, no? It's meant to be for refraction, alternative for glasses. Kung wala namang problema yung mata mo, wag ka nang magkabit ng contact lenses, no? Okay? Kasi delikado talaga siya. Anyway, okay. Retinopathy may happen. Ano pa? Number 7, neuropathy. Neuropathy is equally a complication. Kaya nagkakaroon sila ng paresthesia, no? Okay. Manhid sila, kamukha ng iba dyan. Anyway, wag tayong mag-provoke. Baka may mga ma-provoke na galit dito, no? Okay. Now, those are circulation problems. Complication siya ng DM. Yan talaga. Kung papansinin mo, okay, mga deadly ones, of course, hypertension. Lahat yan actually pwede maging deadly eventually, no? Okay. Siguro ito, death of the future, no? Okay. At that, the point is that, okay, lahat could be dangerous as time goes by, basically. Now, with that then, okay, let's talk about the management ng DM. No? So, meron kang 3Ps ngayon. Ano yung 3Ps mo? Na symptoms mo actually, 3Ps are, okay, polyuria, polydipsia, polyphagia. Meron ka rin triad of management for DM. Common to, guys, ha? Okay, common to. Uy, si John Ray andito, ano? Nako, okay, si John Ray, delikado to, baka mag-hyperglycemia to. No? Ito yung kain sa lecture, eh. Okay. Anyway, let's go back. Let's go to my discussion here. That, okay. Alam ko na kung bakit ako naninibago walang naka-on na video. Pero okay lang guys, okay lang. Ako na lang. Huwag na kayo mag-on. Okay? Anyway, kaya yun yung hinahanap ko actually, yung ka-interact kahit isa dalawa man lang sa isang klase. No? Let's go back here. So saying that, okay, these are complications of DM under chronic complications. Tapos yung acute, we're done with the chronic. Let's discuss now the management. Again, okay, guys. Kung meron kayong triad of symptoms, the 3Ps, meron tayong triad of management. Okay, mnemonic, DAM, D-A-M. DAM, no? Okay, i-discuss natin sorry. Discuss natin pala. Tapos yung complications, na-discuss ko na yan, no? Now, let's talk about the management here, DAM, D-A-M. Now, where D stands for diet. Okay, A stands for, nawawala sila actually, activity, and M stands for medications. Yung DAM na DAM natin na triad of management, DAM, DAM, diet, activity, and medications, no? That is diet, activity, and medications. Okay, so let's talk about the first one, diet. Madali mag-diet, right? Madali mag-diet. Problema, timing, no? Okay? Timing yan, diet, madali mag-diet, problema, timing, di ba? Magda-diet ako, kaya yan, bukas. Kinabukasan, bukas na lang, may review ako. Kinabukasan, I need glucose for review. And then, board exam na, I need glucose. After the exam, celebration muna. Wala na. Walang katapusang diet. Madali mag-diet, problema timing nga. Yun yung mahirap doon actually. So that's all about diet here. Okay, anong absolute diet for DM? Low caloric dapat syempre, no? Okay, I think andito siya. Do I have to write? I think so. Yeah, I have to. Okay, diet natin una-una low caloric yan, no? Pero high fiber dapat. Okay, ulitin ko lang, okay, that's low caloric and high fiber diet. Okay, remember fiber is a very important dietary constituent that can decrease the level of sugar level, no? Kasi fina-flush out talaga niya excessive na glucose actually. may mga nagko-comment dito, yung mahilig kumain talaga si John Ray, andyan, no? And procrastination is life, tama yan, no? Diba? Okay. Well, I had my share of dieting, no? Actually. Let me share my ways of dieting, no? Okay. Kung anong ginagamit ko, anong diet ko ngayon? Diet as tolerated. Kasi kailangan ng glucose pa nagtuturo, nakakapagod kaya, no? Okay. Balikan ko. Dapat low caloric, high fiber diet, and then choose complex carbs, no? Complex over simple. Kasi ang simple, madaling mag-cause ng hyperglycemia, no? Okay. Now, in this case, therefore, diyan pa lang, may selection ka dapat, no? So, example, okay. Ano mas magandang kanin? Is it the brown rice or the white rice? Ano mas magandang kanin kinakain ng diabetic or mga nagda-diet dyan? Okay. Is it brown rice or the white rice? Malamang brown, no? Kasi pag brown rice contains high fiber diet talaga yan. Kung may pambili ka, kung wala naman, di NFA na lang. Okay. Bawasan na ng iba. And guys, let me give you this diet ng diabetic, no? Sige. Ito yung best diet accordingly, ha? At yung best diet, tinatawag siyang prudent diet. Ito siya actually, okay? Is a prudent diet, okay? Sabi niya is percentage distribution. Accordingly, actually sa prudent diet is the best diet for diabetics, no? Again, prudent diet is the best diet for diabetics. Okay? Kasi nga, talaga you can control sugar. Kaso percentage distribution to. Okay, ang carbs daw, ilang percent lang? 50, 50%. Ang fats ilan? 30%. Ang protein, 20%. However, that's not an ideal Filipino diet, no? Bakit? Okay, saan tayo mahilig ng mga Pinoy? Sa carbs tayo mahilig, no? Di ba? Sa Pilipinas ka lang makakita. Ang pagkain kanin, anong ulam mo? Pansit Canton, panalo. Di ba sa Pinas lang yan? Ang tapos cake nga, no? Panalo yan, no? Okay, ano pa, maghanap sa magic tumbler ko? Okay, andito ang aking magic tumbler na ginagamit during lecture. Okay, ito yung agimat ng aking pag-lecture, no? Malamang yung laman yan, coffee, no? Okay, anyway, let's go back here. Prudent diet, percentage distribution, okay, carbs is 50%, fats is 30%, and protein is 20%. Mahirap sa Pinoy yan. Bakit nga? Di ba, typical Filipino handaan, may kanin na, di ba? May spaghetti pa doon. May pansit, ano pa? Okay, cake, ano pa, patupat, tupig, lahat yan puro. Puro umamin kayo. Sige, wag na tayo magpakalayo. Okay, spaghetti is kanin, totoo, no? May nakita pa ako, inuulam yung sauce ng spaghetti, no? Tapos, kanin yan, spaghetti, tapos lalagyan ng noodles sa ibabaw ng pasta, I mean, no? Okay, ganun tayo kumain, eh. Okay, anong favorite food ko, guys? Seafood, no? Ano yung seafood diet ko? Ito, whatever I see as a food, I eat, no? Whatever I see, I eat seafood. Huwag ka na magpakalayo. Okay, doon lang sa ano natin, sa ano, di ba, kumain ka na, no, ng fast food, burger yan, high calorie yan. Okay, may kasama pang french fries, high calorie yan. May kasama pang coke, no? Ayun, panalo. Okay, puro calorie yung kinakain. Kaya ito, ang hirap gawin ng prudent diet, no? Okay, seafoods, no? Dati kasi ang tobacco, guys, no? Wala, hanggang ngayon naman actually, pero at least ngayon, overweight. Dati kasi obese talaga. As in, ha? Okay, obese ako dati actually. Okay, when I was younger than today, wow, okay, parang kanta lang, no? Okay, tingnan mo yung weight ko dati. Pinakita ko ito sa mga students ko dati, pero just to convince you that I know dieting, no? I know how to get thin, actually, no? Okay, kaya hindi rin ako takot tumaba kasi alam ko kung paano magpapayat. Now, although hindi ko yung lecture, share ko lang, SKL, no? Sa mga kabataan katulad ko dyan, alam niyo yung SKL, no? Share ko lang. Yung mga matatanda dyan, maki-ano na lang, no? Maki-ride na lang. Okay. Anyway, okay. So ito ko diet, ayan. Ito yung katawan ko dati, ayan. Okay. Yan yung katawan ko dati, no? Anong hawak ko dyan? Appetizer yan, no? Yan yung klase ng appetizer ko dati. Appetizer yan. Okay. So ayan, kaya muntik na ako mamatay. Okay. Ito yung panganay ko actually. Okay. Ito, malaki na yan ngayon, no? Magano kalaki, mas matangkad na sa akin ngayon yan, no? Okay, around nasa 5'8", 5'9" na yung height, is just 15 years old. Okay, yun yung nagbago yung perception ko about that, no? Okay, ay hindi, Alexis, hindi to Big Mac, ano to? Okay, yung Big Mac kasi nasa 1/3 pound lang yun, quarter pounder lang ata yun, no? Or nasa 1/3, ito actually, buong pound yan, 1 pound yan, no? So, kalahating kilo, kalahating kilo yan. Okay. And itong panganay ko dati, tumakbo sa dagat, di ko naabutan, no? Promise. Okay. Sobrang hingal ko na actually. Okay. Ayan, kaya nasisip ko, baka kailangan ko ng mga payat, no? Kaya nagpapayat ako, guys, no? Kaya I told you, I know dieting very well, no? Okay. Nung pumayat ako, guys, ito yung nag-itsura ko nung pumayat, no? Okay. Nung pumayat ako, hindi yan, mali yung na-zoom ko. Okay. Ito dapat yung, isang mali. But let's discuss na. Sinamahan ko yung mga anak ko mag-jogging, ganyan. Okay? And then eventually, I lost weight, no? Okay? Ito yung katawan ko. Okay? When I was exactly 40 years old na. Kaya pa rin naman. Kung nasa 40 ka ng katulad ng iba dyan, okay, edi, pwede, kaya pa rin, no? Kaya pa rin pumayat ng ganyan kapayat, no? Okay? Anyway, kaya lang ngayong pandemic talaga, Diyos ko, talaga rin naman, hindi mo maiwasan tumaba, no? At ang hirap magpapayat ngayon, in fairness, no? Ito yung pinakagusto kong katawan in the recent years, no? Yan. Yung pinakagusto kong katawan in the recent year, no? Yan. Okay. Yan na. Ako yan guys, ako yan. Okay. Kung di natatanong, ako yan. Let's go. Halika natin discussion natin. Baka may mga magalit pa dyan. No? Okay. Ulitin ko, proven diet now. Okay. Pangalawa is tinatawag na caloric substitution. The number 2 diet here is caloric substitution. No? Okay. In other words, okay, ano to actually? Substitute, nabanggit natin partially, no? Imbis na white rice, pwedeng brown rice, no? Ganun. Okay. Although we have caloric counting, ito ginagawa ko hanggang ngayon actually. Yung tinatawag na caloric counting, okay? Yun nga lang, alam mo dapat yung base calorie mo, ha? Example, okay? Huwag kang lalampas sa base calorie mo. Let me give you my own calorie, ha? Okay, calorie count, the calorie intake per day dapat, no? Unang-una actually, okay? On my age, gender, tsaka height. Anong height ko? 5'6". Okay, gender ko, male. Ang age ko, ayan, yung tatlong yan, ha? Okay, again, we have here age. Okay, unang-una is actually height ko 5'6". Na yung gender ko male, and then my age, ayan, pag kinumpay mo yung tatlong yan, dapat ang calorie intake ko lang per day, okay, is actually 2,000 calories. Hindi ako pwedeng lumampas sa ganyan, no? So I read food labels, no? Example, okay, nag-area isang pack, ilang calories? 400 calories yan. Just to give you an idea, trivia, 1 cup of rice is 200 calories lang, no? Again, 1 cup of rice is 200 calories. Okay? Kaya ang dami mong makita pag kumain ka ng chichirya, check mo muna, no? Ang dami yan actually. Okay? Basta age. Okay. Anyway, okay, magulo. Alamin, okay? Calorie counting yan. Okay, number 4. Okay? So, ikaw na yung calories. Problema lang, hindi lahat naman ng food may calorie count, no? Diba? Example, bumili ka ng balot, meron man nakalagay doon, calorie kapag sa balot, nakalagay, calorie 300 calories. Pero madalas yan, yung mga junk foods, fast foods, yun yung matataas yung calories actually. Okay, so again, anyway, to move on, the calorie counts, substitution calorie counting, last inverted pyramid. Tanong, kailan mas malakas kumain dapat? Breakfast or dinner? Okay, dapat yan, breakfast, malakas kumain, no? Anong kasabihan? Eat like a king in the morning and like a poor man at night, no? Or like a pauper at night. So ito, okay, ganito daw kumain dapat, lakas mo sa umaga, okay lang, sige, hataw ka sa umaga, no? Okay, ganyan dapat, iba sa atin, baliktad. Lalo na kapag may review ka ng on-site, no? Late ka na sa review. Okay, eto, wala kang kain sa umaga, sa hapon, hataw ka, no? Iba, ganito, January, di ba? Ganyan yung iba, o yan, o, ganyan. Talagang walang kaibahan, dapat daw pa ganyan, iba? Pag ganyan, iba naman, pag ganyan, no? Maghapon pare-pareho ng kinakain, no? Same yan. Okay. Anyway, okay, dieting actually, those are ways daw to control that, no? Okay. Kaya dati sinabi nila sa akin actually, ang dali mo kapayat, no? Sabi nila, paano? Sabi ko, isang friend ko nagsabi, huwag kang kumain ng kanin sa gabi, skyflakes lang. Okay, fine. Okay. So, ang dinner ko for a short time, I mean, ang dinner ko actually is skyflakes, no? Anong problema? Hindi naman sinabi kung gaano kadami. Hindi nga sa dinner ko, mga 6 na skyflakes. Sabi niya isa, kainin mo seafoods. Kaya nga, problema ko sa seafoods, whatever I see, I eat. Sabi niya, pilotso po, kainin mo lumalangoy. Fine. Tinuruan ko lumangoy, yung baboy. Walang effect. Pareho lang, no? Kaya hindi effective yung mga diet na yan. Okay? Sabi ng friend kong model, sabi niya, it's so easy to lose weight. Just deny hunger. Fine. I'll deny hunger. Okay? Nagkita kami, sabi ko sa kanya, no matter how I deny hunger won't deny me at all. It's always present, no? Okay, yaan mo na lang. Okay, kasabihan, di ba lang madungis ang kasuotan, wag lang ang kalooban. Kasabihan ko, di ba lang mataba, hindi naman gutom. At tandaan nyo to, pag tagutom, ang mataba, papayat, ang payat, mamamatay na. Walang reserves. Okay, anyway, that is number 1. Number 2, activity or exercise. Now, sir, ba't pinaltan? Bakit pinaltan ng word na exercise yan? Activity kasi nga, aminin natin to, no? Okay, yung word pa lang na exercise, nakakapagod na, di ba? Mag-exercise ka, Pagod ka na agad. Kaya we use the word activity kasi walking is an activity / exercise. Now, anong advantage na activity? Okay, or exercise? Unang-una, enhances glucose uptake by the cells. No? Alright, ulitin ko, enhances glucose uptake by the cells. Okay, pangalawa is that decreases insulin requirements. Kaya pag diabetic 1, kailangan mo nang mag-consult sa physician kasi ang gagawin ng doctor, i-decrease yung insulin requirements ng patient, no? Okay, depending on the i-commit na activity ng patient, kung ilang calorie per day yung balak na i-burn, no? Now, okay, pangatlo is that must be done. Kailan pinakamagandang gawin to? Within 2 hours after eating, no? Kaya hindi exercise kasi pag exercise, iniisip na iba, jogging jogging na pet malo, no? Mga ganyan iniisip na iba actually. Okay, at that, no? As I was saying that, must be done, kailangan to na for 2 hours, no? 2 hours after eating. Kasi it's the time when the glucose is entering the cell. Kaya 2 hours yan, and by the way, must be done regularly. Kasi nga, gagawin ng doctor is that I told you, ibaba yung level ng insulin. Kaya dapat yan may guidance. No? Ang ginagawa sa US is that yung pasyente nag-commit na mag-jogging every example 5 miles a day, no? Kaya ito yung sinasabi ng doctor, ito yung insulin mo, ha? Okay? Kaso pag di ka makatake na insulin, hindi ka maka-jog or maka-exercise, call me, I have to re-regulate your insulin. Ganun siya kasi hindi pwede na sa insulin lang kahit hindi mag-exercise yung patient, no? Baka mag-hyperglycemia siya. Okay, and that anyway, one more here is that other benefits, of course, allows additional snacks. Yan, no? Okay, and yung mga tinatawag na cheat day naman, no? Okay, a cheat day ng mga tao actually. Alright, okay, yung mga cheat day. Di ba? Okay lang yan, basta kumain ka, kung exercise ka, no? Problema lang minsan, okay, may utang pa, no? Like na kasi mga fun run nung pre-pandemic, no? Nakatawa iba, nagpa-fun run, no? Okay, ay, may Jollibee, daan tayo, wala na. Naglalakad, kumakain ng ng kape, no? Okay. Ano pa, we have here, maintains blood chemistry, yung cholesterol, lahat yan nakokontrol, no? Triglycerides, okay? And let me give you a trivia. Okay. Kung halimbawa mag-check ka ng glucose, mataas siya, expect mo lahat mataas lahat, no? Well, by experience actually, nung unang check sa akin lahat, eventually, nung follow-up na, glucose na check natin, bakit nga, nag-diet ka, nag-lose ka ng weight, very important, okay, is that, sabi ng doctor, for sure, pag naibaba mo yung glucose mo, regular activity and dieting actually, then baba lahat, no? Including yung cholesterol, triglycerides, and so on and so forth. True enough, madaling i-control. No? Kaya nga sa katawan, wala na akong, okay na ako. Okay, sir, laki ng tiyan mo, okay lang sa akin yan. Anong tawag ko dyan? Bulletproof shock absorber, no? And bulletproof shock absorber yan. Okay, bakit? Pag suot yung iba, pag payat, no? Suot ng bulletproof. Pag tinamaan ng bala, yung bulletproof, basag yung ribs nila, kasi nga mapayat sila. Ako, basag ba? Hindi. May built-in bulletproof shock absorber yan, no? Kaya okay lang yan. Okay. Anyway, balikan natin po. Okay. As I was saying, that case, yun yung diet at activity, ang pinaka-ayaw mong makita sa exam, hulaan ko, gamot, medications, no? Okay. Ito yung trivia kasi guys, no? Don't memorize all the drugs. You know why? If you attempt to memorize all the drugs, after the exam, kailangan mo ng drug. Ano yun? Haldol. Sigurado ko, baliw ka. Okay. Wag ganun, okay? But understand the medications actually. Okay? Kasi let's talk about the drugs na unang-una pag type 2. Pag type 2 natin, okay, yung mga OHA, no? Oral hypoglycemic agents. Na bakit type 2 lang? Binibigay lang guys kapag functional yung pancreas, yung islet of Langerhans. Anong ginagawa nitong gamot na ito? Dalawa, no? Okay? Unang-una, inactivate niya para yung beta at alpha, no? Beta says to release insulin. Okay, beta to release insulin to lower blood sugar level, right? Okay, it increases insulin and decreases glucagon. Para hindi mag-undergo ng glycogenolysis yung katawan, para hindi mag-convert ng glucose yung katawan, no? Thus, controlling the blood sugar level, no? Okay, must be done 2 hours. Ano must be done? In 2 hours actually, no? Okay, and sige, ulitin ko OHAs tayo, okay? Increases insulin and decreases glucagon. Okay, na ano yung common na binibigay, yung mga inase, no? Okay, ano yung mga inase, nakakainis, ang dami, no? Okay, mamaya ng side effects, bakita ko yung mga common examples ng OHAs are the following. Okay, mga diabinase, ano pa? Orinase, ano pa? Tolinase, ano pa? Micronase, ano pa? Nakakainis, ang dami nila. Pero sikat ito, si glucophage, no? O tinatawag na metformin, no? Estudyante ko dati, sir, meron pa, pinapatanong ng patient, meron pa daw metformin na iiwan? Sabi ko, metformin, hindi yung metformin, no? Okay, metformin, metformin. Okay, common side effects are the following. Natural, unang-una actually can cause possible what? GI upset. So pinakamaganda, okay, again, this can cause possible GI upset actually. So pinakamaganda is to give it within meals, no? Absent tuloy. GI, upset. Okay? GI distress or GI, upset. Now with that, okay, so pinakamaganda within meals. So example, kain muna yung pasyente ng konti, no? Enough na to buffer to cause to avoid the distress. Ang gagawin na, inom ng gamot, then kain ulit. Ganun siya actually. Okay? So bakit hindi before? For sure, magkaka-distress yan. Bakit hindi after? Too late na. Too late na pag binigay mo after yan, kasi nga pag after binigay, mataas ng sugar bago gumana yung gamot, no? And pangalawa is hypoglycemia. Ito very important, guys, no? Kasi I told you, dalawa yung effect niya. Possible effect namin depending on the type of it. Okay? Pero yung glucophage is noted to do both, no? Yung glucophage noted to increase insulin and lower glucagon, thus controlling the blood sugar level. So prone talaga magka-hypoglycemia ang patient, no? Okay? So therefore, very important to actually assess for the manifestations of hypoglycemia. So I made an acoustics. Mnemonic, no? Yan, mahilig tayo sa review minsan, yung mga mnemonic at saka mga acoustics, no? Di ba? Okay? Yung problema lang minsan, kabisado mo yung mnemonic, nakalimutan mo yung content, no? Sample, memorize ka ng 14 cranial nerves. Okay? O to touch and feel, blah, 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 blah. Nung susulat mo na, oh no, nakalimutan ko anong mauna, ganun. Ganun tayo minsan, nakakalimutan. Alam mo yung mnemonic, nakalimutan mo yung content, no? Yan. Okay, yung madalas nating problema sa memory problems, no? Okay. And that then, so in which case, let's go discuss now the manifestations tayo ng hypoglycemia, no? Para to give a mnemonic and a visual for that, okay, gutom yung mnemonic ko, no? Gutom yung mnemonic natin sa manifestations ng hypoglycemia, no? Okay. Or G stands for gait disturbances. Again, G stands for gait disturbances. Okay? Nahihilo siya kasi because of dizziness. Sulit ko na rin lang, no? Okay? It's because of dizziness, meron siyang gait disturbances, no? Okay? Pangalawa is actually unusual perspiration, no? Okay? Unusual perspiration or the aphoresis of that. Ano pa? As a way of compensation, the heart compensates by way of tachycardia. Tandaan mo, pag magkakaproblema ang katawan, lalaban ng puso, no? Hanggang sa dulo, paglalaban ka ng puso. Okay? Anong O stands for obvious tremors? Siyempre, manginginig yan talaga. Okay? Na-experience natin, pag gutom na gutom tayo, actually, no? There's obvious tremors. At pang-apat, moodiness or irritability, no? Moodiness or irritability. Ano ba yung mali spelling? Okay? Irritability. Those are the manifestations of hypoglycemia. Now, question the board. Okay? Question now. Ang pasyente pag nagka-hypoglycemia, what's the first? Pag na-observe mo itong mga assessment na yan, assessment for as manifestations for hypoglycemia. If you observe these things, what to do? Give oral glucose level, no? Sources, sorry. Okay? Pag ang manifestations of hypoglycemia are the following, okay? What to do is give oral sugar sources or glucose sources, no? Now, okay? Tandaan natin to, guys, pag nagbigay ng option sa exam, kung anong pinakamaganda ibigay, always choose the liquid form. Okay? Ayan, tama yan, Gladys, orange juice, hazel, pwede yung candy, no? Okay? E so, paano nakalagay doon? Sa actual board exam natin, nakalagay candy bar, candy, chocolate bar, okay? Ano pa isa? Apple fruit or orange juice. Anong pinakamaganda? Pag binigyan ka ng options between solid at liquid, sabi ko lang, between solid at liquid, sabi ko lang, the better ones are the liquid form. Make sure lang na meron siyang sugar, no? Kasi sa NCLEX dati, may naka-encounter. Okay? Nakalagay ba naman sa option is diet cola? Malamang, kung diet, walang sugar yan, di ba? Kasi diet cola na yan. Okay? Kung diet, walang sugar yan at all. In other words, okay, choose the liquid form with the sugar content, no? Okay? Those are the manifestations of hypoglycemia. Gutom as the mnemonic. Yan yung OA siya, ha? Ito na. Okay? Ito na yung, ayun, number 1 talaga yung orange juice. Paano kung, sir, pwede ba, Hubert Landicho, no? Okay? Hubert, Landicho ako actually. By middle name. I'm from Batangas. My mom's from Batangas, no? Mga kamag-anak kita. Kung taga Batangas ka, no? Okay? Anyway, let's go back here to our discussion now. Manifestations of hypoglycemia, okay, are the following. Management dyan madalas, oral glucose sources. Okay? Actually, madalas ang mga liquid form, no? Now, kung pwede naman cranberry juice, kung walang orange juice, basta may sugar, ha? Okay? Sugar yan, ano? Okay? Anyway, to move on, let's go discuss now the next one here. Okay? Ito yung mas ayaw makita, insulin. Diyos ko, types pa lang, ang dami na, no? Okay, para makita nyo ng buo. Okay, namnamin itago ko yung sarili ko, no? Lahat yung mga types na. So, lagyan ko ng number, ha? On the left. Okay, A are the rapid-acting ones, which are clear by nature. A is rapid-acting. Okay, B, the intermediate-acting, which is cloudy by nature. C is actually long-acting, cloudy by nature, no? Okay, now guys, of all these things, one thing I would want to encourage you to do is what? Okay, kung mag-memorize ka man dito, i-memorize mo dyan yung, yung peak of action, no? Why? It is during the peak of action when you observe for the most severe or most serious hypoglycemic reaction. So ito memorize mo, okay, yung peak, yan talaga mo problema dyan ang pasyente pag nasa peak of action ng gamot, no? Okay. At that, okay, so example, nakalagay sa exam dati, I forgot the year, nagbigay ng gamot daw ng Humulin R at 0700 hours, no? 7 a.m. So nakalagay anong sagot doon? The best time to observe for severe hypoglycemic reaction, okay, is actually at what? 0900 to what? 1100 hours or 9 to 11 a.m., no? Okay, yan siya actually. Alright, okay. So, ang pinaka mag-observe ka, peak of action. Na isa pang tanong dito sa madalas sa insulin na yan is that, okay, can you mix insulin? Yes. Pwede mo mag-mix ng A at B. Pwede. A at C. Pwede. B at C, madalas hindi. So, principle guys, para madaling maalala, ang minimix madalas, A or B, A and C, pero hindi B and C, no? Ayun nga lang, in mode of injection. By the way, sub-Q dapat yan, ha? Okay. So, example, meron akong syringe, no? Syringe to. Ito yung syringe na pang sub-Q. Wala akong makitang props kanina. Nakita ko yung pang-inject ko ng manok. Ito yung syringe ko, alim mo. Ito siya, actually. Ito sa pang ID dito, intradermal, no? Ito yung syringe, example. I have 2 insulin, for example, I have may props akong printer, Ganito ako kaseryoso sa pag-lecture this afternoon. Okay? Ito yung clear insulin. Nakikita ba? Ayan, clear. Ito yung, palitan ko yung clear ko para mas may difference na. Okay? Ito yung clear. Ito yung cloudy, ha? Ito yung clear yung vitamin E ko. Ito yung cloudy, no? Okay. So, clear and cloudy. Now, question here. Can you mix insulin? The answer is yes. Ano nga? Okay. Kung tayo naman sa exam, where do you inject air first? Mag-inject na, is it clear or cloudy? Pag di kayo sumagot. Again, where do you inject air? Is it the clear or the cloudy? Saan ka muna mag-inject? Cloudy muna, tama na. Inject air on the cloudy muna ba? Yes, sa cloudy muna. Kaya lang, make sure not to touch the solution, no? Kasi dapat di makontaminate yung clear, yung needle mo. Napaka sa syringe ko, no? Okay? Sige lang, okay to. Okay. Pag salbahe yung pasyente, ito yung pang-intradermal mo sa kanya. And clear, cloudy, no? When injecting air, saan mag-inject ng air muna sa may cloudy muna, right? Make sure not to touch the solution. Now, pag inject mo, mag-aspirate ka na, hindi pa, no? Tanggalin mo yung needle doon with the syringe. Okay? Syringe with the needle, I mean. Lipat ka sa clear, right? Okay? Clear, inject mo doon, and then, ano ba yung cloudy ko? Teka muna, mali yung props ko. Okay? Ito yung clear insulin, ito yung cloudy, ha? Ito yung clear, ito yung cloudy, ha? Basta, tama naman sinabi ko, mali lang yung prop using, no? Okay? Injecting, when injecting in muna, saan muna sa may cloudy. Make sure not to touch your solution, right? And then, lipat ka sa may clear. Ano gagawin mo? Inject and then aspirate, no? Then, lipat ka sa cloudy, aspirate na. Then, you were able to protect your clear insulin kasi itong hindi pwede na makontaminate. So, however, ang tanong sa exam madalas nga ito, saan ka una mag-aspirate? Huwag kang malito, pag aspiration tanong, no less than the clear insulin. Pero pag injecting air, hindi ka sa may cloudy. Now, let's discuss na administration of insulin. Na ito yan, okay? Sige, anong route niya guys? Subcutaneous route. Dito maraming nagkakaroon ng issues sa contentions. However, let me echo, okay, the protocols by ADA, no? Kasi some books would say, sige, ito. Okay, pwede naman lahat ng disputes, no, actually. However, subcutaneous route, no? Kaya lang, ito yun, no? Okay, clients with DM1 are self-administering their insulin. That's a known fact, di ba? Yung may mga DM1 are self-administering their insulin, no? Okay, kung ikaw mag-i-inject sa pasyente mo, pwede kang gumamit ng regular way of sub-Q, which is actually what? 45-degree angle, no? Pero, pag yung pasyente, anong tuturo natin? 90 degrees. Saan mag-a-adjust lang sa needle na, length ng needle, no? Again, ulit ko. Okay? Kung nasa hospital yung pasyente, ang route, subcutaneous route, tama? Okay? And that, okay, kung pwede mong gawin, ikaw mag-inject sa patient mo, pwede mong gamitin yung 45 degrees, right? Kaya lang ito, okay, if you're gonna teach a client self-administration of insulin, dapat yan, okay, is ituro mo yung 90 degrees, no? Yun nga lang, give the proper needle, okay, yung length para hindi umabot ng intramuscular area. Sir, bakit sub-Q, sir? Okay, kasi it's less painful than ID. Less painful than ID, pero slower than IM. Kasi pag masyado nang mabilis yung insulin, guys, okay, pwede mag-cause ng immediate hypoglycemic reaction. So, less painful than ID, intradermal, and slower than IM. Kaya din naman ginagamit yung subcutaneous route actually. Now, however, okay, adjust sa needle na ginagamit, no? Pag thin ng pasyente, needle tayo, okay, pag payat, needle use actually, pag thin, payat siya, ang ginagamit is actually what? 3/8 of an inch, no? And what do you do with the tissues? Tissue rather is you have to pinch it. Again, pag thin ng patient, 3/8 of an inch, pinch the tissue. Okay? However, pag medyo obese yan, Ang pinakamaganda yan guys, ginagawa sa US, caliper, no? Kinakaliper yung fats talaga. Para malaman kung gaano kalaki, kahaba yung needle na gagamitin, no? Kapag obese siya, 1/2 or 5/8 of an inch, no? 1/2 or 5/8 of an inch, okay? And what to do is actually to what? To stretch the tissue. Yan. Okay? Yung gagawin nasa, again, ulit ko lang, you teach this actually, you teach this kapag tuturuan mo yung pasyente to self-administer their own insulin. Na again nga lang, make sure to inform the client, never or avoid massaging, no? Avoid massaging kasi massaging will promote rapid absorption, thus can cause possible immediate hypoglycemic reaction. So make sure to avoid massaging. Now, okay? Part pa ng ating administration of insulin. Let's wind down, no? Okay? It's actually we have refrigerate unused insulin. It's destroyed by long-term exposure to room temperature. Okay? One more is that you have to never shake the vial of insulin. Why? Okay? Pag nag-shake ka ng vial ng insulin, nag-shake ka ng vial ng insulin, it will cause formation of bubbles, right? Pag may bubbles ang vial, it will be difficult to aspirate the exact amount of insulin. Again, shaking because formation of bubbles, and formation of bubbles okay, make it more difficult for you to actually aspirate the exact amount of insulin, no? Okay, like that. So therefore, anong gagawin mo Anong gagawin mo pala? If you're gonna mix the content of the insulin, kasi pag galing sa ref minsan, okay, yung residue nasa ilalim, yung clear nasa taas, no? Kailangan mag-combine. What to do then? I know you know it, how to shake it, how to mix it, roll it in the palms of your hands, no? Yung gawin mo actually, roll it in the palms of your hands, okay, para i-mix mo yung insulin. Again, avoid shaking. Shaking may cause formation of bubbles, na. Okay, one more. For the management, prevent lipodystrophy. Now, how? Okay, una-una, lipodystrophy actually are deformed fats, no? Again, lipodystrophy are deformed fats. Pag nag-deform yung fats, inaccurate na siya. Ilang na lang iikutan ng insulin, matatanggal pa ibang parts, no? So make sure to prevent lipodystrophy. How is that so? Okay, letter A is to administer at room temperature. Never administer cold insulin. Right? Kaya pag galing sa ref, take time dapat, or yung pag-roll mo minsan, nakakatulong, no? Okay, at letter B dyan, actually is to rotate the site, no? Rotate the site of insulin, once again, to avoid deforming of the fats. It's called lipodystrophy, no? Rotate the insulin site or simply rotate the sites na lang. Sites of insulin administration. Okay, yun siya. So with that, so ano ba yung mga rotation plans natin? Ano ba yung mga rotation site? So inuulit ko lang, instead of shaking, you have to what? You have to roll it in the palms of your hands, no? Okay, yan siya. Now, in this case, let's go and discuss now. Let's show lang, pakita ko lang yung mga rotation sites natin, ha? Rotation sites for, ito siya actually, lumampas. At yung rotation site natin, ha? Okay, sir, nasan yung harap dyan? Yun, nasa kanan, no? Ito yung harap kasi may pusod, no? Kaso guys, abnormal yung pusod niya, no? Nasa symphysis pubis. Hindi pa lang tumaas ng konti. Andun sa symphysis pubis yung pusod niya. Dapat lang mataas-taas ng konti, no? Anyway, yun yung rotation plan actually ng insulin administration, no? By the way, so ano yung repercussion pag nagka-lipodystrophy? Well, it will invalidate the area for injection, no? Nag-risk naman, nagka-dystrophy dito sa braso, okay? Then bawal na mag-inject doon kasi nga hindi na accurate yung absorption ng insulin. Okay, so with that, let's talk about now some more side effects to observe the following. Okay, with that we have here localized. Ano yung mga localized side effect are the following? Unang-una, okay, actually is nawala. Okay, mga redness, injury siya or redness. Namula siya. Pag yan guys, actually tuloy-tuloy yan, ginamit pa rin yung area, tuloy yan to become lipodystrophy, no? Sige, okay. Pagka nag-injury siya or redness, pwede eventually ng swelling, no? Okay, pag nag-swelling, ginamit pa rin, nagkaka-lesion na siya. Eventually, doon nagkaka-lipodystrophy. Doon nagkaka-lipodystrophy yung area, no? Okay. Kaya dapat dyan, dito pa lang start ng gamitin, no? So, ano nakalagay kay Brunner? Okay. Na-confuse dito. Sorry for that. Okay. Nakalagay kay Brunner actually is that, ito, no? Pagkatuloy ako. Okay. Kapag nagka-redness na, yun na simula daw niya, no? Pag nagka-redness, sinisimula ng pwede maging lipodystrophy. So, ang suggestion, okay, pag nakita mo ng induration, avoid using the area for 4 to 6 weeks, no? Avoid using the area for 4 to 6 weeks para hindi tumuli to have swelling, lesion, tsaka lipodystrophy. Ayan, okay? So, iwasan natin na actually ang lipodystrophy. Na yung systemic effects naman, okay? Systemic effects na are generalized. We have number 1, systemic effects na unang-una, hypoglycemia nga ulit, no? So, again, ulit ko lang, okay? Localized are the following: redness, induration, swelling, lesion, tsaka lipodystrophy. On the other hand, we have next will be generalized, no? Generalized effect, actually, una-una, hypoglycemia. Kaya I told you, watch out lagi, especially in the peak of action, no? Okay. At pangalawa, tinatawag na Somogyi phenomenon. What is that? Rebound hyperglycemia. Somogyi phenomenon, ipaliwanag ko lang yung Somogyi phenomenon sandali, no? Now, let me explain, ha? Meron pang Don phenomenon, eh. Okay. Pero sige, dito tayo mag-focus muna sa Somogyi. Dito lang sa Somogyi phenomenon, no? Simple lang yan, no? Okay. Kailan nagkaka-Somogyi phenomenon? Pag sobrang pag-take ng patient ng insulin. Or, nag-take siya ng insulin, tapos nag-undergo siya ng heavy activity, no? So again, okay, nasobrahan yung take ng insulin. Example, makakalimutan yung pasyente, no? O kaya nag-take ng insulin, enough insulin, pero nag-undergo ng heavy activity. So what happened there? Imbis maging normal sugar level, bigla siyang okay, nag-aglycemia, no? That's aglycemia, halos walang sugar yung kanyang katawan. Okay, good or bad? Good sana siya, bad siya actually, no? Aglycemia, bakit lahat ng part ng katawan gumagamit ng sugar, di ba? Nag-aglycemia kasi sobra yung insulin or nag-take na enough insulin pero nag-undergo ng heavy activity. Now, tuloy nagka-aglycemia siya. The body wanted to compensate by releasing what? Glucagon, which if you would recall, will cause glycogenolysis. Okay? Tsaka glucocorticoids. Kasi compensation ng mga yan, ito enhanced gluconeogenesis. Ano mangyayari therefore? Okay? Yung aglycemia, biglang tataas yung blood sugar, right? Magkakaroon ng rebound. Rebound hyperglycemia is what we call as Somogyi phenomenon. Again, rebound hyperglycemia is what we call as Somogyi phenomenon. Okay? If you're okay, sige, last part na lang guys, last part na lang yung foot care, sama sa topic, no? Kasi remember, foot ulcers are totally preventable, no? Okay? Although parang lang siya, parang rundown lang, and some of them actually are really, parang kumbaga, common sense reasons, no? Okay? Which is bound for us to actually discuss to our client, no? Okay, let's go. Sige, alam kong gutom na. Kung gutom man kayo, gutom na ba? Kung gutom na, okay lang. Gamitan nyo ngayon ng glucagon. Ipakita nyo sa mundo, gumagana yung hormones ninyo, no? Okay, balikan natin dito. Let's discuss now, no? So what are, let's go and discuss the foot care, no? Okay, si John Ray, busog na daw. Siyempre, kain ka ng kain, no? Okay, foot care tayo. Okay, so ito example ng foot ulcers, oh. Lipat ko na yung sarili ko at mukha kong ulcer dyan. Ayan, no? Yung mga foot ulcers, tingnan mo yung isa dyan, no? Nakatapak ng pako. Tingnan mo, ha? Yung nasa taas actually na may sugat, no? Nakaapak ng pako yan. Okay, yan ang pinuntahan niya. Yun naman nasa baba, if you notice there, naka-heels lagi yan, no? Naka-heels sa ganyan lagi. Yung pressure nandito. Kaya nagkaroon ng sugat sa ganyan, no? So ano yung unang-una, inspect the feet daily. Wag monthly, wag weekly. Why? Remember, meron siyang paresthesia, no? May neuropathy, baka hindi niya alam, may sugat na siya, no? Okay. Na pangalawa, sa foot care, actually, wash feet with warm water and mild soap, no? Wag harsh, no? Anong pinaka-mild na soap? Okay, yung mga walang amoy, no? Hindi walang sabon. Walang amoy na soap. Actually, yung mga mild soap talaga. Okay, now what else is that we have to wear comfortable, properly fitted pair of shoes. Na anong suggested are leather or canvas, or yung pinaka-latest na in-endorse ng ADA, no? At saka WHO, yung nasa taas na brand, no? Na medyo mahal. Okay, medyo mahal. Actually, yung brand na Crocs, di ba? Okay, yung nasa taas actually, okay, bakit yung brand na yan? Kasi unang-una, soft siya, no? Soft rubberized. Kailangan magsuot ng socks actually. Now, okay, hindi magsusugat yan kung nakasocks yung patient, no? Okay, one more is that, ito, ginagawa ko to kahit di ako diabetic, ha? Na suggestion, break in new pair of shoes. Ang suggestion, leather or, 1 to 2 hours per day, no? So, what does it mean? Kapag bago ang sapatos mo, halimbawa, no? Kahit gaano kaganda yung sapatos mo, okay? Kahit gaano kaganda yung sapatos mo, kahit gaano ganda yung brand. Kung excited ka, sinuot mo maghapon. Ano mangyayari sa'yo? Paltos sa kasulat. Kaya pag graduation day, naming umiiyak eh. Bakit? Ang tagal mag-start ng program. Pagod na yung mga tao. Puro pa kasi bago yung shoes, no? Kaya sa board exam guys, don't wear new shoes, no? Huwag na. Yung luma na lang. Make sure lang may swelas pa, ha? Baka magpasok mo dun sa room, ba't ang lamig na semento? Wala palang sole, no? Okay, so, ang ginagawa ko is that, if I have new pair of shoes, for example, anong ginagawa ko is that, ay ang suot ko pag-umpisa ng araw ko, bago muna. Bago, no? Okay? And then, pagkatapos ng 2 hours, I replace it with the old ones, no? Kasi yung luma kasi, yung naka-fit talaga sa sapa ko, no? Na hindi magkakos ng blisters sa mga wounds, no? And so on. Okay? Na hanggang sa suot ko ng 2 hours per day, eventually, nagiging fit sa paa, nagko-follow sa contour ng paa, it will avoid any wounds or any blisters at that, no? Okay. Anyway, to move on, pwede kagatin matindi, okay? Ano pa actually is that we use white cotton socks for males. Now, white cotton, simple reason, absorbs extra perspiration. Mas pawisin ng lalaki sa babae, di ba? And pangalawa, why white? For easy assessment. Ganun lang, no? Kasi pag itim, okay, ay hindi pa madumi yan, wala pang traces ng marka. Kaya pagtanggal ng sapatos, tumayong mag-isa, no? And actually, white cotton socks yan, okay? For easy assessment at cotton to absorb extra perspiration. Now, more for that. Okay, at example lang, ulcers, no? Ayan, gangrenous na to, necrotic na, oh. Teka lang, mukha akong gangrene dyan, tanggalin ko yung sarili ko. Ayan. Okay, yan, no? Tinan mo to, tinan mo yung mga pang yan. Pag ganyan, talagang candidate for amputation yan, no? Just to avoid septicemia. Okay, so with that, let's go. Ano pa ang gagawin? Common sense, actually, avoid going barefooted. That's common sense, no? Okay, ano pa is that avoid trimming the toenails laterally. Sinong guilty dito, guys? Mga babae, di ba? Nagpapa-pedicure, no? Okay, tinakat yung gilid para magkaroon ng form, pinapatanggal yung ingrown, no? Pag tinatanggal yung ingrown, lumaki siya, tapos medyo umilalim siya yung pagtubo, naku, sugat yan, no? So, yung ingrown yung problema, hindi. Yung method ng pagtanggal. Because accordingly, of course, you know that, hindi magadaling magtanggal ng ingrown na walang sugat, no? At lahat ng sugat, actually, hindi pwedeng sa taong diabetic, no? May nag-request pa shoutout daw kay Atherton, no? Kay Atherton Manaog. Okay, I don't know from where you are, pero shoutout to you, no? Okay, anyway, shoutout na rin sa mga nasa Facebook, no? Okay, shoutout ka na sa mga andyan, sila Ain, sila mga kilala ko dyan, no? Okay, oh wow, sa taga-Tacloban, okay, ADF Fellows College of Nursing. So, shoutout to all of you in Tacloban and the whole Philippines, no? Okay, avoid trimming the toenails laterally. Kasi pag tinanggal yung ingrown, pwede magkaroon ng sugat, no? Okay, pag ginagamitan ng ano nga ba yun? Nakalimutan ko na naman term. Okay, yung plies na maliit, lagi ko nakalimutan. Stripper, ano pangalan nun? Ano nga yun? Yung, nipper, yan, thank you. Nipper, stripper na naman naalala ko. Okay, tsaka yung pantusok, no? Yung pantusok na yung parang bakal na ganyan, yung basta, ganun yung pangalan niya, no? Okay, anyway, let's go back. Yung ganun yung tinutusok na ganyan. Pusher. Okay, ayun, pusher, no? Pusher, ano pa, user, drug lord, tsaka warlord. Pinag-uusapan natin, no? Anyway, ano may avoid? Wearing knee-high or stay-up stockings kasi nag-impede ng circulation, no? Impedes further circulation. Okay, and also we have here, Naomi from UAE, from Saudi, Saudi ka nga ba? Hello sa mga taga-Saudi dyan, may nanonood sa Saudi, no? Okay, apply lotion, okay, on the feet. Now, yun nga lang ito, ha? Ang problema ng lalaki actually, okay, talaga? Donna Cruz from Cairo, Egypt. Wow. Hello sa inyo dyan. Okay. So saying that, ayun pa, okay. Itong problema ng babae naman, ang lalaki to reason, no? Problema infection like athlete's foot. Kaya white cotton socks can help out, no? Okay. Ang babae naman, mas dry yung paa nila. So ngayon, kailangan mag-apply ng lotion, no? Kaya pag nag-dry naman pala, pwede mag-crack yung heels. Susugat yan, no? So pag babae, anong suggestions that apply lotion but not on the interdigital spaces, no? Mas maganda, tama. Okay. Joseph Reselis, yung suggestion, mas maganda yung lanolin, no? Kasi mga non-fragrant sa mga yun, non-fragrant, mild sila to the skin. Pwede rin Vaseline sa totoo lang, no? Okay, at that, no? Shoutout kay Kia, kay Christine, okay, mga nasa Saudi at nasa Egypt, no? Okay, anyway, to move on, ano pa, importance ng massaging exercise to promote circulation. Kasi remember, pangit ang circulation sa paa, di ba? Okay, sa the entire body, and the last here, for any signs of injury, consult a podiatrist, no? Okay, so guys, I hope you learned something this afternoon. It's been an honor working with you. Okay, an honor, it's a pleasure actually teaching you this afternoon. Again, thank you to TopRank. Now, bukas, ang lecture will be, ito, idol ko sa CHN to, tsaka CD, no? Okay, ang lecture will be Sir Jesse Daclis, no? Okay, pag nag-aasa recommendation sila, okay, Sir, may ma-recommend ka na lecture ng CHN tsaka CD, well, napapagataan, Daclis agad yan. Okay, so please be excited for tomorrow. Ito, napapanahon yung kanyang topic, no? Okay, so thank you so much, guys. Thank you so much, everyone. God bless you all. Okay, Bina, hello sa mga taga St. Luke's dyan. Okay, at that. Alright, okay. So, Omar, yung may concern. Okay, magkaiba yung sobrang layo ng DI, no? DI is actually a fluid check electrolyte problem, and DM is actually metabolism problem, no? Okay, I will wish to discuss that in a brief manner, kaya lang medyo mahirap siya in brief manner, no? Okay, tsaka mga taga, shout out daw sa mga Fatima Valenzuela, hello sa inyo. Okay, and then, shout out to everyone na lang. God bless, stay safe everyone. God bless you all. Okay, in my case, you are dismissed. TopRank, ma'am, thank you po sa ating administrator. Thank you po, TopRank.